Gamers, gamers, good hacky morning, good afternoon, good evening, and welcome. Happy Hacking Tuesday to you. I hope your day has been treating you super well. I've been living under the constant pressure that I have an exam today and I need to study. So I hope your day has been treating you much better. Thank you for letting the song finish. Oh, I actually don't have the sound back, so I guess that's a whole like coincidence. How do you call it? I didn't know, basically. That was just good timing, teehee. Well, hello, let me see my hellos. We'll talk about what we're going through today. Or what we're going to do. And hopefully life will be good? Question mark. But I remember, hey, welcome. Let's go. Welcome. Hi, Galo. Hi, Gao. welcome. Totally. Hi. Welcome back as well. Welcome with the please emo. Dun. Hi, Pata as well. Hi. Welcome. Hi, Yoshi as well. Welcome. Gamer time, aka study time, baby. It's study time. It really is. I don't really remember the last time we've had a study stream. Well, yeah, all the streams I've been doing have been study streams, but you know, like, I politely regurgitate my notes. But it's time. Let's go. Hi, Pals as well. Hi. Welcome as well. Me when I hit the books. Oh, I was hitting those books yesterday. The books hit me back. Me when I hit the books. Ham smash. Oh. me right now trying to fight for my life. Bye, Karma. Hi. Welcome. Oh my goodness. Karma, I saw you yesterday at the very end. I looked back at chat. I was like, oh no. I didn't even get to say hi or bye. Lamenasawi. Hi, Atomic as well. Hi. Welcome. The thingy. Let's go. Huh? Diaphoresis? Pog? Big Pog. Exactly on loop. I'm glad there was such good timing. Weight loss? How do I sign up for it? Get some horrible manifestation that will hack you up. I got you. Thank you. No hacking problem. Got to always do the shout outs. Alright, gamers. So today's plan is we're studying differential diagnosis, and we're focusing on lung disorders and gastrointestinal disorders. So we're gonna go in the order that the exam sheet goes off. My classmate made another guide which has some additional information that we'll kind of skim through, and from there we'll also go see about doing some questions together. Now the questions already have their answer, but obviously we can kind of just work backwards and logic it out, like why is it B? More likely it's gonna be me like, oh yeah, it's B. Why? Just sounds right. Process of elimination, baby. Cameron says, I was like, no, you're so good. Absolutely no hecking worries. And no problem for the shout out as well. That's shit. No worries. You missed that. Don't worry. You're at work, my dude. Enjoy work. You worked in Tipalong? I did. I had to make Tipalong a little bit smaller, but I'm glad to have them both. They're so cute. Thank you, Azali. Thank you, Azali. What do I specialize in? Nothing. I'm a student. No, I'm just kidding. I'll answer. Rehabilitation. But yeah, the reason why I'm learning very medical stuff, very English, hello, you understand what I'm saying, right? Cause anyway, the reason why I'm doing this is because some manifestations of some disorders that we'll be learning about may look more musculocutaneous, which is just a very fancy way of saying, like, hey, you might have shoulder pain, but it's actually your gallbladder that's doing that, and that's why you have that pain, because it has a referral pain pattern to that, and blah 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 blah. We'll get into it later. But hi Shira, hi, welcome. Pazza says, who needs to have logical reasoning if you have good stomach feeling? I'm a stomach ache survivor. I don't know why I said stomach like that, but please. I meant to just say tummy. But yeah, let's talk about the basics of what are ways we can identify something between like your organs are kind of hacking you up versus if this is actual muscular. So with that, let's get into our first topic according to the focus sheet, and we're going to talk about constitutional symptoms. So constitutional symptoms are how do you call it? Let me switch screens. Please ignore the size difference. But let's talk about constitutional symptoms. So these are basically your red flags, and of course red flags is the next category we're talking about, but no one wants a red flag. Basically, red flags are just basically indicators of something that you may have a more serious pathology or a disorder that may be affecting you, and these symptoms might be going along with that. And then there's also green flags and yellow flags, but we'll talk about that a little bit later. Anyway, constitutional symptoms. It's a person presenting with fever, so you know our normal, oh gosh, what is our normal body temperature? Basically, if someone's over 100, it's pretty bad, you know? This is my friend study guide. Yeah, so normal temperature is 96 to 99.5. Sorry, I got spooked out. I'm like, oh no, my classmates are actually there. I'm not gonna dox my classmate. No, but you know, American, working in Fahrenheit. Yee, heckin' huh. But yeah, basically if you're over 100, you're getting feverish. But definitely, what do you call it? 99.5 is like the edge of normal. Them acting single when on a relationship is a red flag. Yeah, huge red flags. We can talk about relationship red flags all day. Look out. No, I don't think I'm special. I was like, oh yeah, we'll do that another time, chat. We'll just have a whole stream dedicated to relationship advice. Oh my goodness. I'm an expert. I've seen a lot of failed relationships. I've learned from other people. Like, probably wouldn't stay with them if they're treating me like poop. But they're nice sometimes. Yeah, not enough. Anyway. So yeah, fever, diaphoresis, so unexplained perspiration, which is just sweating. So you're not just sweating because it's hot, it could probably be cold. And oh, I'm sorry, totally. I'm sorry. We'll talk about it later. How about that? But it's just unexplained sweating. You can have sweats, which can occur any night or day. Nausea, vomiting, diarrhea, pallor. Pallor is just like a paleness to your skin. You look a little bit more pale than usual. Like, are you okay? And it's like, oh no, I'm not. Dizziness and syncope are also constitutional symptoms. Syncope is just another fancy word to say fainting. In addition, they'll have fatigue and weight loss. And it's not just weight loss, like, oh, congratulations on your intermittent fasting. No, thank you, Cubs. No, but it's also, how do you call it? They lose a certain percentage, and I think I have it right here. Yeah. Unexplained weight loss. So if they have more than 10% of their body weight in 10 to 21 days gone, that's scary. I think the normal like weight loss should be about, sorry about even speaking about weight loss, sorry, but the normal or average should be about like 2 pounds a week. So let's say you're 100 pounds and you're losing 10 pounds and you lost 10 pounds within like a little over a week. That's horrifying. Hi Joey, hi, welcome. Oh my goodness, my friend, did you did you not derank? I want to say no, you didn't, because I got some moment badges and I guess I was there for that moment of when you didn't derank, but I had to politely look because I was still studying. Welcome. Let me ta-dang. Drew was playing Valorant, by the way. And I was like, I'm not gonna derank, and I'm like, good luck with that. I understood the struggle when I was playing Overwatch, and gosh darn it. Anyway, so yeah, those are some red flags. Constitutional symptoms are red flags. Other red flags that we could see is general malaise, which is basically like tiredness and fatigue. Oh no, my thing is slightly cut off. There you go. Unexplained fever, unexplained weight loss, which we just talked about. Cancer in history, prolonged use of corticosteroids, trauma in the history, like if they had a fall, night pain, which can also be a positive symptom or like one of those indicators if you have carpal tunnel syndrome, if you have night pain, and that's something I guess we're never going to talk about, but if carpal tunnel comes back up again, we'll talk about it a little bit more. And another red flag is just widespread changes of sensations in the arms and legs, like maybe you lost sensation, or maybe you're having like a tingling or burning. Dizziness also plays a part of it, and just problems with balance or vision is also a huge red flag, like what is going on in your brain basically. As for yellow flags is kind of like, hey, let's stop and slow down a little bit. Let's think about some cautionary or warning symptoms, basically things that we need to think about for screening. So sometimes people's yellow flag is about their beliefs, appraisal, and judgment. Some treatments they may not believe in. There's a good majority out there who don't believe in ultrasound, and it's kind of like, oh well, yeah, ultrasounds for pregnant women, and it's like, no. You can also use You can also use ultrasound for like wound healing, and you can also help it to reduce any of the inflammation and promote like the healing process. But there's some people who are like heavily against it. Emotional responses is something you have to watch out for. Like, not to put my roommate under the bridge, but she won't let me like put my hands on her because the thing that I'm studying to become, she had a really bad experience, and she's like, yeah, I just don't want to be touched, which is completely fair and fine, you know. But I felt bad because I'm like, oh, I think I can help you with this for your insert diagnosis here, even though I'm just a student. And I'm like, I think this would be good, can you tell me how this feels? And she's like, no, don't. And I'm like, okay, I will never bring this up ever again. And just pain behavior in general, there's some people who are just hypersensitive. Like, you touch them and they're like, ah, that hurts. And it's like, does it really hurt, or do you have like this like weird preconceived notion that basically any sense of like touch or anything on that area is going to cause this like pain? So something just to keep out for, of course. Huh? Karma, I can't answer your question. I don't know anything about music anymore. My music days are gone and behind me. You ended up with positive R? The what? RR? Let's go! Hacking, congratulations! Another Valorant player? Yes! Another red flag? Yes! No, I'm just kidding as well. Rainer, hi, welcome. I went to your discussion of carpal tunnel because I have it. You gotta do the Valence test. Valence test. You can do the reverse one, and you put yourself into, like, if you're doing a prayer, bring your elbows up so you're making like a line with your body, and press into your palms of your hands. Just press into the hands. Do you feel tingling? Congratulations, you do have carpal tunnel. Yay! There's definitely more to that, but that's one of the special tests to test for that. The Naruto thing? Exactly! Huh? You mean ultrasound just doesn't detect babies? So there's diagnostic ultrasound and there's therapeutic ultrasound. We're already past that in my book, so I'm not going back. But basically that's it. Yeah, in music days, I did. I used to play the trumpet and French horn. And I guess if we're counting the recorder when I was in elementary school. Oh my goodness. I know how to toot horns. That's what you have to do in the mouthpiece. You just have to make this noise. And a beautiful horn sound will come out. Anyway. You won't bring it up now? Oh no, you're fine. I'm sorry. If it ever sounds like, excuse me, I don't want to talk about it. I'm also just like, guys, I only have like 5 hours for this exam to cram. So let's try to see how much we could do, because we do have 67 pages of notes to get through. So let's go! Tingling or pain? Tingling. Shouldn't be painful when you do the reverse valence. Don't confuse a stretching sensation for pain. And if you do have pain, that we'll talk later. Yay! Yay! Tipanya recorder master? Yeah! Bring me out a recorder. I could probably play hot cross buns. Hi, welcome. Oh my goodness. Okay, let's talk about our first disorder, okay? Let's talk about bronchitis. So, what the heck is bronchitis? So, in your lung anatomy, which would have probably been a really good image to pull up, you have these tubes, and they're called your bronchial tubes, which help carry air to the lungs. So what's happening is that there is you can't see because my head is in the way, but there you go, the picture right here. There's going to be inflammation of the lining, and because of this inflammation, it says mucus. No, but okay, you get mucus. Oh, heck, bronchitis. Anyway, there's inflammation. And with that, I guess there can be mucus depending with the acute or chronic that we'll talk about a little bit later. Oh, guys. And basically it narrows down the airway. And so for acute bronchitis, that is the inflammation of the trachea and the bronchi that is self-limiting and of short duration with few pulmonary signs. So the acute may be a result of viral infections, such as maybe someone has like the flu, measles, chickenpox, whooping cough, whooping oh, or whooping cough. It's whooping. I'm like, huh? I have like Burger King Whopper in my head. Anyway, Or acute bronchitis can also occur due to chemical irritation such as smoke, fumes, and gas. So just be careful where you're at, basically. Chronic bronchitis, on the other hand, this is associated with prolonged exposure to irritants, and they're accompanied by mucus hypersecretion and structural changes. So this is something more likely along the lines that if you're exposed as a secondhand smoker, basically, you have heavy exposure to cigarette smoke, or maybe a long-term inhalation of dust or air pollution that's going to cause hypertrophy. Oh my gosh. Guys, I don't want to speak anymore. I'm going back to the study streams of the Pomodoro. But yeah, hypertrophy, there you go. Mucus producing cells in the membrane. So what does this all mean? So bronchitis, you know, your itis is normally associated with inflammation. Bronchi is just referring to the bronchial tubes. We have an inflammation of the lining of the bronchial tubes. We either have acute or chronic. But here are some of the signs and symptoms and how we're going to distinguish between acute and chronic. Acute is acute. It's only lasting for a short while. It's not chronic. Chronic is considered anything over 4 weeks or a month. So acute clinical signs and symptoms are going to be mild fever for 1 to 3 days. Simon, thank you so very much for the follow on YouTube. Let's hacking go. Once I learn how to change those notifications, I got you. Oh no. Anyway, sorry. Cherie says, I remember getting it multiple times and I sounded like a wheezing penguin from Toy Story 1. Let's go! The wheezing penguin from Toy Story 1! I'm so sorry. How? What? What? Anyway, I had laryngitis maybe like 2 semesters ago, and it was the most awful thing because it was right before a practical, and I'm like, wow, I have to speak for this practical, and I'm like, I can't speak. Anyway, acute bronchitis, you end up with a mild fever for 1 to 3 days. You have malaise, which actually, again, that's like the fatigue. That is something that can help distinguish between acute and chronic, because you don't have that with chronic. You can have back and muscle pain, sore throat, and cough with a sputum production, followed by wheezing and possible, look at that, laryngitis! Let's go! Laryngitis! Which is the inflammation of the larynx, or the voice box, which is why I sounded awful. Or basically had no voice whatsoever. So for chronic bronchitis, though, it's going to be a persistent cough with the production of sputum. Basically mucus. And it's very productive, but it's worse in the morning and evening than in the midday. There's a reduced chest expansion, so when we ask you to inhale and exhale, your chest is not moving as much. Wheezing, so I'm not going to replicate it or I won't have a voice for the rest of the study stream. Cries. A fever, like a solid fever, not a mild fever, can be present. Dyspnea, which is basically shortness of breath. Cyanosis is also present, so basically a blue discoloration of skin, mucus, and membranes. And why do you think that occurs? So think of it like the cartoons. If someone's having difficulty breathing and they're like choking or whatever, they normally turn blue or purple, and that's basically the same case here. If the bronchial tubes are responsible for bringing air to our lungs, then if we don't have that happening, we're basically quote-unquote suffocating, and so that's why we're going to have that blue discoloration. Oxygen is not going where it should be going. And then you also have a decreased exercise tolerance. Try asking someone to do like the Stairmaster and they have bronchitis, like hello. Blood Knight, I see ya. I will inhale air. Okay, I didn't like die that time, thank hecking goodness. Hi Blood Knight, hi, welcome. Huh? Cherry says LMAO, I imagine your diagnosis someone going, yeah, bronchitis, let's go! Bronchitis! Yeah, I'd be so happy because I was able to diagnose that for you. Smile emoji. Oh my goodness. I noticed I get dysphonia when I'm stressed. Wait, when I'm in stressful situations for multiple days? I don't blame you at all whatsoever. Are you referring to like the shortness of breath, or dysphonia is something else? Let's double check. Where's my mouse cursor? Ah, dysphonia. Difficulty speaking. Oh no. No, I don't blame you. Stress is a lot on the body and it treats people different ways, you know? No voice? Sorry. Just say you've gone through enough. Let's talk about pneumonia. I said that right. Yes, the closed caption said I said it right. Let's go. So, pneumonia is really interesting, and we'll look at this in a little bit later. Let's get the general idea. So, if bronchitis was the inflammation of bronchial tubes, pneumonia is going to be the infection that inflames the air sacs in either one or both lungs, and it may be filled with fluid. So we can see it in the picture. Look, it's our air sacs, and this is normal, not supposed to have any fluid in your lungs. And then here you go, fluid filled. So it's like, ooh. So pneumonia can be primary or secondary. So primary, like it could be a disease of its own, or secondary in a sense that this can occur due to a complication of another disease. It's normally followed after influenza, or basically the flu, and it can be caused by various things. So it can be due to aspiration. So maybe you had inhaled something in the airways, such as food, fluid, or maybe even vomit. You know, I guess maybe that's more common like in people who are hungover. You can have inhalation of toxic or caustic chemicals, smoke, dust, or gases that can inflame these air sacs. Or simply, you could just have a bacterial or viral, or don't ask me what that word means, infection. So this could be commonly seen in the rehab setting, and common features of it is just the inflammatory pulmonary response to an offending organism or agent. So most of the time, it is going to be bacterial. There are 3 types of pneumonia. There's a hospital-acquired, there's a ventilator-associated, and there's a community-associated. And we'll talk about each one, I believe. If I was like very nice, I would talk about them. Apparently I didn't. But no matter, the one that's most important right now, according to my test, it's going to be the hospital acquired. So let's talk about some of the risk factors of just getting pneumonia in general. So risk factors: infectious agents present in upper respiratory tract causes no harm unless resistance is lowered by other factors. Okay, so some ways to increase your chances of getting pneumonia could be smoking, having a severe cold, disease, alcoholism, or generally poor health. And we're not talking about poor health as in like, oh, poor you, but we're talking about very objective stuff, like maybe you have poorly controlled diabetes. You let your blood sugar spike up or go way too low. Maybe you have chronic renal problems, which is referring to the kidneys. And maybe you just have a compromised immune function. So you know, the people who you hear about having that lower immune system and that easily get sick. What about vaping? Well, smoking and vaping basically go hand in hand, unfortunately. Vaping is not like a healthier alternative to smoking. It's just a much more cooler, zoomer way, you know? Smile emoji. Anyway, hospital acquired pneumonia, some risk factors are definitely if you're over the years of 7 years old. If you're much older, you cannot really fight infection as easily. Maybe you have some serious comorbidities, malnutrition, impaired consciousness, prolonged hospitalization, and COPD. Really, what's the idea about this and having these risk factors for hospital-acquired pneumonia is that you're older, you're bedridden, and because of the physical inactivity and immobility, apparently like the fluids just kind of sit in your lungs, which is a very interesting thing. And let's see. Apparently, by definition, HAP, the hospital-acquired pneumonia, occurs 48 hours after hospital admission. When HAP develops into a mechanical ventilated patient after endotracheal intubation, it becomes VAP. Anyway, alright, let's continue on. So pneumonia, there's no middle ground for pneumonia. Your risk factors that you're either a baby and you're very, very young, or you're very, very old. You don't get your vaccine for pneumonia? Hello? Scrubs. Smoking, air pollution can also affect it. I don't know what URI is, unfortunately. I have no idea why I wrote that and I wasn't like, what is this? Upper respiratory infection? Oh, that's why. Altered consciousness, so maybe alcoholism or head injury. Endotracheal intubation, recent chest surgery, prolonged immobility, immunosuppressive therapy, AIDS, prolonged exposure to the vibrant organism, malnutrition, dehydration, chronic diseases such as diabetes mellitus, lung, heart diseases, or cancer can also be a cause of pneumonia. Aspiration of the oral gastric foreign material, so again, breathing down the wrong hole can cause pneumonia, so make sure to chew your food. Inhalation of noxious substance, so something that may be noxious, toxic, bad for you. Chronically ill, older clients with poor immune systems, often residing in group living situations that transfer from one healthcare facility to another, and or hospitalization in the fall or winter can definitely be some risk factors of getting this potential fluid in your air sacs, basically, or infection. Is that how we're doing it? Yeah, infections of the air sacs. Hi, hi, welcome. How are you doing, smart girl? I'm panicking. I have this exam, and then I have another exam tomorrow, and I have another exam on Friday. But other than that, I'm doing great. Thank you for asking. I hope you're doing super well. Anyway, so some clinical signs and symptoms. So, some signs and symptoms that you may actually have pneumonia is the sharp and sudden pleuritic chest pains that are aggravated by chest movements. So, you know how sometimes you have chest pain? Well, maybe that's a me thing. Maybe I should go see a doctor. What happens is that this kind of movement actually worsens with chest movement, and it's like, pneumonia? Shoulder pain, hacking or productive cough, so that kind of cough. Dyspnea, which is again that difficulty of breathing, the shortness of breath. Tachypnea, which is fast inhalation. Cyanosis, which again is that this blue discoloration. Headaches, fevers, chills, sweats, generalized arcs. Brother, you know I was not writing this. Aches and myalgia. I don't know how to say words. Again, I can see it, but I don't know. But let me double check what this word means. Myalgia is muscle aches and pain. Oh, yeah. Like fibromyalgia. Knees may be painful and swollen. Patients definitely presenting with some fatigue, and again, confusion in older adults or increased confusion in clients with dementia or Alzheimer's might also be indicative of pneumonia. So, yay. All presentations basically, this is referring to a case apparently. They may present as normal. They may not even have any red flags or history as a smoker, but maybe some knee pain. They're like, I'm complaining of some knee pain. And it's like, oh, that might be an indication of pneumonia. But what happens is that when you do the screening, you put the stethoscope, the doctor, when they check your heartbeat, they're also trying to see about different sounds that you have on your body, in your body. And what's going to happen is when the doctor asks you to breathe, what's going to happen is that they're placing it over the lungs. They'll hear this crackling, bubbling, or even rumbling when you inhale. So, da-da. Did anyone hear a dog whistle? BRB crying. Many exams, so many. I am stuck in the test loop, and it doesn't stop. Anyway. Carmen says, I don't vape, but I have friends who do. I'll smack them. Educate them on the risk. Let's go! That's so good. Sometimes, I think it's important to have friends that... I just think it's important to have friends, but I think it's important to have people who can, talk to you about, hey, this is not good for you, Lung study? Lung study! Hi, Seth. Hi. Welcome. Jess says I get pneumonia pretty often, so I'm a pneumonia expert. Oh, no, I'm so sorry. Alright, so let's talk about asthma versus bronchitis. So bronchitis, again, we said, was the inflammation and can appear with mucus in either the acute or chronic. So that's one indicator of how to differentiate between them. But asthma is going to not have a productive cough, and it can be genetic. My nephew has asthma, and I'm just like, oh, I don't know where you got that. I guess you got that on your dad's side of the family, because gosh darn it, I know my mom doesn't, or I thankfully do not have this. Thankfully, I don't think I have anything, but like, let's not drink that. Anyway. anyway, so asthma is considered a reversible, which I was like, it is? Obstructive lung disease in which a person's airways become inflamed, narrow, and swell and produce extra mucus, which makes it difficult to breathe. So we could even see it here in this picture of the lady who's holding onto her chest. We see that this is a normal airway, pretty big hole, but if you have an asthmatic airway, there's a mucus buildup, so it makes it very difficult to breathe because again there's a constricted airway. This is being blocked. So asthma is considered a chronic inflammatory condition with acute exacerbations that can be life-threatening if not properly managed, which is why you see a lot of people who have asthma, hopefully they have some kind of inhaler, or maybe you also heard the term like rescue inhaler, you know? Asthma can be categorized as conventional, occupational, or exercise-induced, but the underlying pathophysiology complex remains the same. You hate it? It hurts so much. I'm so sorry. My dad only uses his inhaler whenever he feels pain and he's adamant on not being dependent on it. Unfortunately, I don't know enough to be like, your dad. But I do know there's quite a few people who I've met in my lifetime who are adamant about not doing really anything. They're just like, I don't want to take medication. I do this natural. I have a headache. I'll get through it. And it's like, okay. Anyway. Signs and symptoms of asthma, so shortness of breath, wheezing, a tightness in the chest, coughing is also very present. So these are going to be, the 4 that I just mentioned are going to be the most common ones that you're going to find with people with asthma. They have irregular breathing with prolonged expiration, noisy or difficulty breathing, episodes of dyspnea, which again is that difficulty breathing. When they clear their throat, they feel like a tickle at the back. And maybe they have a cough with production or without production, but this is especially in absence of a cold, and it usually occurs about 5 to 10 minutes after exercise where you feel like you have a little bit like phlegm, so you're like If you did the same thing with the stethoscope example and having the doctor check, so what would they find is that when they ask you to inhale and exhale, they're seeing if they could hear for any wheezing, irregular breathing, the noisiness, etc. With people for asthma, we should look for skin retractions on the clavicle, so the collarbone, ribs, or sternum. Look for a hunched over body posture or inability to stand or sit up straight or relax because they feel more comfortable. They feel like maybe they could breathe a little bit more. And we'll talk about another condition where that's also the case. They have pursed lip breathing, so I believe this is the like if you do like a little kissy face, like the putting your lips together like that is considered pursed, I believe. So it's just a like that kind of breathing is something that they'll have. Their nostrils will be flaring. I can't really do that. It won't it won't show. But you know, like you open up your nostrils and like you're trying to get as much air as you can. An unusual pallor or unexplained sweating. So basically, again, that unusual paleness, or hey, why the heck are you sweating? It's cold here. What's happening? People with asthma, we should ask about restlessness during sleep, vomiting, and fatigue unrelated to working or playing. Bears don't have clavicles? Don't say that. Then what am I touching? No, I'm just kidding. Anyway, let's talk about tumors. Yay. So there's something called the Pancoast tumor or apical tumor. So this is a kind of cancer that's going to start at the top part of the lung, which is the apex, hence the word apical. Gosh darn it. Anyway, so what happens is that with this tumor that's happening at the apex, not legends, of the lungs, the top part, it's going to present in distribution of the C8, T1, and T2 dermatomes, which we'll look at in a little bit. Oh, thank gosh. I feel like every time I see a dermatonal picture, I see like male genitalia. I'm like, stop! Please! I just want to show this on stream. Anyway, what happens with this presentation and distribution of having pain in the section is that it's going to mimic another disorder called thoracic outlet syndrome, which is, you know, it's so funny because I did just learn about this maybe like 4 weeks ago, and the the summary of TOS is like really escaping me. I could tell you how it kind of occurs, but let's get Dr. Google on the line. Alright. Thoracic outlet syndrome is a term that refers to 3 related symptoms involving the compression of nerves, arteries, and veins, and the upper neck and lower chest area. Or sorry, lower neck and upper chest area. My bad. So when they refer to dermatomes, they're referring to here, so they're going to have this kind of pain pattern, and this is going to follow from the front and the back. And that's weird, right? Because it's like, but my lungs, but they're having these sensations all through here, and that's why it's really important to do a very appropriate screening. I looked it up, they don't. That's so sad. Anyway, tumor invasions of any anatomical structure. Oh, so again, as you see with this, basically what's happening is that you may just have disability with the arm and hand if you have a pancreas or apical cancer. The extension of this tumor, however, apparently is going to result in Horner syndrome, which is consistent of this term called, how do you pronounce this? Anophthalmos. Oh my goodness gracious. Which is basically a backwards displacement of the eye, which is horrifying to think about. Ptosis, which is the drooping eyelid. And meiosis, which is pupil constriction. So can we see it here? Okay, good thing they don't put the backwards displacement, but apparently it can also result in constricted pupils. So you see meiosis right here. You can also see here in the comparison where this should be your eyes, but one of your eyes is like tinier than the other. Droopy eyelid, ptosis. And the other word, failure to sweat, and hydrosis, which is like, it could be 110 degrees, but you're not sweating. Huh, that's a little weird, huh? Anyway, some signs and symptoms of a pancreas tumor is going to be that the person is coming with sharp, often posterior shoulder pain. So we can see it here. Posterior shoulder pain, produced by invasion of the brachial plexus or the extension of the tumor into the parietal pleura. Pain in the axilla and subscapular areas of the affected side. So subscapularis is a muscle that we have towards the front of our shoulder blade. Also in the axilla, it's referring to armpit, and we see the red hovering over that. Pain radiates up to the head and neck, across the chest, and up or down the medial aspects of the arm and hand. So basically, again, this image right here. Cough, hemiparesis, and dyspnea are uncommon until later in the disease. Alright, so that is a pancreas tumor. Let's move on to another lung disorder that we have. We have something called emphysema, which is something also pretty common. I'm sure you have to have heard of it at least once. So emphysema is going to be a lung disease that's going to cause breathlessness, so not able to inhale air. May develop after a long history of chronic bronchitis in which the alveolar walls are destroyed, leading to permanent overdistension. Overdistension refers to overstretching of the airspace and a loss of normal elastic tension in the lung tissue. Emphysema. Remember we talked about bronchitis being that Don't talk to me about pronunciation. I think it's dyspnea, right? Dyspnea. Oh goodness gracious, great balls of fire. We'll figure it out. Anyway. No, we should figure it out because I'm about to read it. Ah, panic. Alright.
Dyspnea.
Dyspnea?
Dyspnea.
Dyspnea? Okay, it's the first one. Anyway. So emphysema is usually caused by cigarette smoking. When we talked about bronchitis, we were referring to, hey, this is exposure to smoking and etc. Chronic bronchitis, again, is exposure to smoke. And yes, of course, it's like, oh yeah, the person smoking it is exposed to smoke. But yeah, they inhale it, they exhale it. Those things are definitely in their lungs. And if you have a long history with smoking, you might end up with this disorder. So what's gonna happen is that you're gonna end up with shortness of breath, dyspnea. It's like dismay, but in Italian. Wait, but Italian? Dismay? Dyspnea. Dies. Anyway, orthopnea, which is gonna be only able to breathe in an upright position immediately after assuming the supine position. So, supine is just a fancy way of saying that you're laying down on your back. So, what happens is that if you're laying on your back, the person with emphysema is gonna complain like, I can't breathe, I can't breathe, I can't do much, please sit me up. And as soon as they sit up, they're able to breathe, which is strange, right? Chronic cough is going to be present with those with emphysema, and a barrel chest will also be present. I don't know if I have a picture, so let's grab one because I feel like that's one of like the key factors. So barrel chest, emphysema. Hold on. Pink puffer, blue bloater. Someone brought up a good point. Hold on. We're gonna get a few pictures in here actually. Oh, this is the world's tiniest photo. Are all of them gonna be super low quality too? No! Alright, let's get a higher quality one. I like this drawing too. But let's see if we can find another version of it or something. Because gosh darn it. Oh, we did! Let's go! Alright. So anyway, let's continue. So emphysema, you're going to also be present with weight loss, malaise, use of accessory muscles of respiration, such as your scalene muscles, which are muscles that are going to be on the back, prolonged expiratory period with grunting, so when you go wheezing, pursed lip breathing, which again is the kissy face breathing, increased respiratory rate, and peripheral cyanosis. And with that, I will politely hydrate so we can talk about the difference between chronic bronchitis and emphysema. Okay, where the heck is my water bottle? Thank you for the hydrate reading. I still have my gallon of water. Badum. Run away. Please. Alright. So let's talk about the difference. So chronic bronchitis is also known as blue bloater, and emphysema is known as pink puffer. Oh, let's double check. Yeah. Chronic bronchitis is clinical diagnosis, daily productive cause for at least 3 months or more in at least 2 consecutive years. People with chronic bronchitis might be overweight and blue, cyanotic, elevated hemoglobin levels, peripheral edema, so extremity swelling basically, and I don't know what raunchy means. Not raunchy, like, you know, like ooh, that's anyway. But I know what wheezing is, so I guess maybe it's like a but emphysema is a pathological diagnosis. It's the permanent enlargement and destruction of the airspace distal to the terminal bronchi. So what they may present us is that they're like older and thinner, because again, this is like prolonged smoking. Severe dyspnea, which is basically that shortness of breath. They have a quiet chest, and if you were to look at their x-rays, you would see a hyperinflation of the flattened diaphragm. So it's a lot of information. This is how they basically present. Look at that guy with his blue cyanosis. Ta-da! So scandalous. And pink puffer, look how like tiny this man is. But look, there's like a barrel chest with it, which is why they look a little, like, I guess you would say bulkier. Wait, but then we say emphysema's barrel chest? Wait, then what the heck is barrel? I thought barrel meant big. Okay, Cubs, we're getting another picture of a barrel chest. No way! Oh, I see. Here, Cubs, give me one moment. Oh no, I put in the header. Heck. So this is a normal chest, and this is a barrel chest. You see how like bulky it is, and that's gonna be present with emphysema. Other cool things to know: again, bronchitis is gonna have the chronic productive cause, while pink puffer is going to be a shortness of breath. Alright, let's talk about this term, cor pulmonea. Definitely not how you say it, but definitely something my professor kind of stuck in there. I did not know how to find this. Let's see if we can find Dr. Google's way of this, because I'm not gonna lie to you, still not completely sure what it is. So let's see. I keep getting like this like random like or actually maybe this will work. I keep getting this word associated with a right-sided heart failure, which we will talk about in a little bit, to be honest. That looks like a game enemy. Leave him alone, it's just a side profile. It's like you have a barreled ribcage? Yeah, basically. That's why it's like bulky like that. Let's just use this definition. Thank you, classmates. I appreciate ya. So this term called core pulmonea is basically an altered right ventricle, and this can be altered in a sense that it's hypertrophied, dilated, etc. So it's just getting bigger, resulting in pulmonary hypertension, which can be used to cause pulmonary embolism, yes. This can also be accompanied with COPD, shortness of breath. I don't know what this word means. OEDEMA. Let us look up, because I am learning. A buildup of fluids in the body. So this is just swelling, I assume maybe specifically on the feet. Yeah, basically it's edema, but what happens is that this is trying to be more specific to feet. Hypoxia, so what happens is that maybe they're not getting enough oxygen. So what happens is that your normal oxygen level, whenever you put this pulse ox, like if you ever go to the hospital, forbid that you ever have to go to the hospital for anything serious, your oxygen levels, I believe, should be 95% or higher, I think, or 95 or 96% higher to 100. But it's very rare to get 100. Most likely, most of the time, you're gonna get 99. So anything lower than that 95, I believe, 92 is a pretty distinct mark. That means you're not getting enough oxygen, and that might be indicative of something maybe incorrect or wrong with the lungs or heart. Speaking of heart, right-sided heart failure is also associated with this. I don't know what DRUP means. Hepatomegaly, so increased liver, and cyanosis, so maybe your toes are blue. Alright, pulmonary embolism is present when the oxygen saturation rate, so that the thing we're seeing up here, is less than 90%. The heart is going to compensate with a higher beat per minute, and the most common cause of pulmonary embolism is going to be DVT, or a deep vein thrombosis, and that's something we talked about in a previous study stream, where it's like, oh yeah, those blood clots? Oh yeah. So what are some clinical signs and symptoms of this? So you're going to have peripheral edema, so bilateral leg swelling, a chronic cough, central chest pain, exertional dyspnea, or dyspnea at rest, distension of the neck veins, so your veins are going to increase in size, fatigue, wheezing, and weakness. Remember DVT against that blood clot? Pulmonary embolism, DVT clot gets dislodged and ends up in the lung vessels, and cor pulmonale is the heart is working harder to compensate, and because it's working harder, you end up with pulmonary hypertension. Da-dang. Let's see. The pathophysiology of this? You're still saying this? No, I don't know how to say it! Dysnephia. The pathophysiology of this is a result of increased right-sided filling pressures from pulmonary hypertension that's associated with disease of the lungs. Anyway, angina! Yay! Angina! So this angina pectoris is basically just a pain in the chest. Very acute though. So it's like, my chest hurts, and then it's gone. So angina, again, acute pain in the chest, is going to result from the imbalance between the cardiac workload and the oxygen supply to the myocardiac tissues. This is temporary in comparison to myocardiac infarction, because normally when you see or hear, I guess maybe in like the cartoons, of someone having a heart attack, they grab on and they're like, my chest hurts, and they go, and then they die. But again, angina is referring to, again, temporary. Angina is a symptom of obstructed or decreased blood supply to the heart muscle, primarily from atherosclerosis, which that's going to be in reference to an inflammatory condition affecting the coronary arteries and the peripheral vessels, often accompanied by hypertension and signs of PVD. Was that no wrong? Listen, we'll talk about MI or the heart attacks in a little bit. So what's going to happen with angina, the signs and symptoms, is that there's a gripping feeling of pain and pressure behind the breastbone. The pain may radiate to the neck, jaw, back, shoulder, or arms, and most often in the left arm in men. You may have a toothache. Don't ask me about that one. I have no idea why. Burning indigestion, shortness of breath, exercise intolerance, nausea, and belching. So what kind of anginas can we have? So what's gonna happen is that you can have one that is supply ischemic. So basically, gosh, I think there's a better one. Hold on. Is this better? The world can only know. I feel like there was like a typical thing about like pregnant women only having like the second variant one, and anyway. So you can have the stable version of it. The stable is also the equivalent of the classic version, and that's going to be due to atherosclerosis, which is going to occur with exertion and exercise. You may have this pain in your chest. What's going to happen with stable angina is that it's going to be relieved by rest or just medications in general. The variant angina is going to be due to coronary spasms, and it's typically during at rest or early morning hours. Again, I feel like I heard something about pregnant women, but who knows. And unstable angina is going to be referring to atherosclerosis with a blood clot, and so that's going to be severe pain, often occurs at rest or with minimal exertion. So that person is not doing anything and they're in pain. Kind of serious. This one is actually not relieved by rest or medication, so it's kind of like a good luck, have fun. Speaking of fun, hi Baz, hi, welcome. How are you? I'm sorry, I'm talking about medical stuff. Alright, abdominal aortic aneurysm. So first of all, I feel like a picture would be much better, so let's grab one for you cubs. One hacky moment. Da-dang. Hold on. Sorry. I did say I was gonna look up an image, but I also did what do you call it? I did also look at my DMs, and my friend's like, you want to go watch the Barbie movie on your birthday on Saturday? And I'm like, I have school. I don't know how to break it to you. Hold up, this isn't geography class? I know, isn't that spooky? Alright. Let's do this. Let's do that. And let's do this. No Barbie movie. No Barbie movie on birthday weekend or opening weekend. Bow! You know, there was actually, sorry, this is slightly off topic. There was a local theater. No, I don't even think it's local. Let me rephrase that. It was not local. It's a little far, but it was a good like middle ground between me and my other friend, and we're gonna have like a little group, and we're gonna be like, yeah, let's go. How do you say it? They're doing like a special. It was like a $60 like movie ticket, but it came with like a 3-course meal and like cocktails, and I'm like, what? And it was a 21 up event, and I'm like, no way. Did I? As a forever 17-year-old bearcat, I definitely could not attend the event, but I thought that was like such a fun way to like kind of celebrate the opening or the start of the Barbie movie. And I wish they had it for more dates, but it was only for openings, so like boo, when? Oh, Trey, my birthday's on July 22nd, but I can't celebrate it until all my exams are over. So I think I will celebrate it on stream, maybe at the earliest, the 25th. Maybe. Or maybe the 26th. My gym bros invited me because the view would be hilarious. I think it'd be so fun. I think the Barbie movie is gonna be so good. A 3-course meal in the cinema? Yeah, so there's been more fancy cinemas popping up lately, where it's like, oh, you can have like a dinner and a show, or we'll give you food, or you can get food and here's like a dining room table. Like, I don't know, let's pop up a picture. Well, no, maybe let's not pop up a picture. I'm sharing this document and I see 3 other active people in this document. I will not put a random cinema in here. I'm honestly tempted to go. We did it for Frozen 2 and it wasn't that bad. I think it'd be cute, and I think the Barbie movie's for everyone. Not that Frozen 2 wasn't for everyone either, but I don't think you should like feel discouraged or anything. Hey, my brain is bad at birthdays, but carving it into my brain, do not worry. Every day we celebrate life here, so happy birthday, Chewy. Happy birthday to you. Happy birthday to you. Happy birthday, dear Chewy. Happy birthday to you, Tan Tan. There you go. See? Alright, so abdominal aortic aneurysm. So you can't see it because of my fake head. So I'll move it here. So normal aortic aortic, hello, where am I? Normal aorta, so the aorta is coming off. Look. Aorta is coming up from the heart and it goes down. Ta-da! It goes to the ascending aorta, and then it becomes the abdominal aorta. And this is how it should normally look like, right? But right here, guess what? It's bloated! That's bad! You don't want that! And that's called an aneurysm. So, an aneurysm is an abnormal dilation and a weak or diseased arterial wall causing a sac-like protrusion. Yeah, that bad boy's pretty chunky. Aneurysms can occur anywhere in the blood vessel, but the 2 most common places are the aorta and the cerebral vascular system, which we won't talk about. Don't want to talk about neuromuscular or neuroscience right now. The aneurysm may be dissecting, which means that it has a tear that has occurred between the 2 layers of the intima and the blood that's flowing between the 2 layers rather than through the lumen, whatever that means. Abdominal aortic aneurysm, our AAA disorder, is going to occur 4 times more likely than thoracic aneurysms. The most common sites for AAA is below the kidneys, with referred pain to the thoracolumbar junction, and we'll see a picture of the referred pain pattern in just a moment. Aneurysms can be caused by trauma or weightlifting, especially in aging athletes, congenital vascular disease, and infection, atherosclerosis. What the heck? Who wrote this? Anyway, pain referred down to the middle low back, superior to gluteal fold. So basically, hey, you're having some pain in that like swelling of the abdominal aorta. Here's the pain pattern that's going to refer to. They're going to have low back pain right above the do they call it gluteal fold? Yeah, I guess they do. Like your the butt crack. And also on your left flank is where they're also gonna have pain as well. My heart? Oh no! Carmen says that looks like a pigment. Does it? I guess. If I like squint. Eh? Hey Tips, how's the studying going? Hi Liv! Hi Liv, how's it going? It's going well. I'm just, you know. Page 19, let's go! Page 19 out of 60! I forgot. 71! Oh, I added images. I'm like, why did this increase? Please, no more. No, but I'm doing good. Thank you for asking. I hope you're doing really well. Alright, so dissecting aortic aneurysm. So what other things can we find? So the location of it is gonna be in the anterior chest, or abdomen, or thoracic area of the back. That pain is going to move in the chest as the dissection progresses, but the pain may extend to the neck, the shoulders, the interscapular area, or the low back. And what's going to happen is that people with this kind of disorder is going to have a knife-like or a tearing sensation, or have a dull ache in the lower back or mid-abdominal left flank region. The intensity is pretty severe. It can last for hours, and some associated signs and symptoms may be absent pulse, person senses a heartbeat when they lay down, palpable pulsating abdominal mass, lower blood pressure in one arm, and other medically determined symptoms. There's no relieving factors, but what can aggravate it is laying on your back. But yeah, now we'll talk about anterior and venous insufficiencies after I do some curse head pats. Let's go! Hi Husky, hi, welcome. Thank you for the cursed head pat reading. Let me just move my bottle of water. Da-dang! Da-da! Dun. Alright, but you want cursed head pats, not cursed dorsal head pats, so and 1 and 2 and scooby-doo-doo-doo-doo. And these are your cursed head pats. Ta-da! Hope you enjoyed them. Eh? Love says this thing reminds me that I still kind of suck at English. No, you're so good. Do not worry. These are all medical terms just thrown at you. Curse grabs? Curse grabs, let's go! Free liver too? Let's go! Anyway. Oh, goodness gracious. There's so many things about arterial and venous insufficiency. But it's important to go over because yada 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 yada. Let me see if I can move it a little bit more over here. I don't want to put it in the header. I just want to move it so you cubs can see it. Gosh darn it. We'll just zoom in and we'll just zoom out. I don't know. I'll read it to you from far away, okay? I wasn't feeling this document at first, but then I saw the Comic Sans. Brother. Alright, so arterial. So arterial is referring to our arteries. And we know that, what do you call it? Oh god, please let me not confuse this. This would be very embarrassing. Arteries is to bring blood away from the heart to all our other parts of our bodies and extremities, etc. While our venous is going to help get that blood that's in other parts and bring it back to the heart. So let's focus on one section before going to the other. So for arterial, if you were to have an arterial insufficiency, its warm oxygenated blood is having trouble getting out to the tissue. The pulse of these people may be weak and thready. If they're absent, it's very bad. Like, why are they having an absent pulse? Hello? Are they dead? What's happening? The appearance of someone who may have arterial insufficiency may be that their skin is dry, flaky, or shiny, no edema. And, you know, honestly, I would love to show you cubs like arterial ulcers, but I'm not gonna lie to you. Whoever is running my intake class to show me wound stuff and wound care, they just show gore like nobody's business. It's like, oh, here's a hole in this person. I'm like, what? They love shock humor in that class. But I don't think it's necessarily appropriate for stream, but it does go hand in hand with these insufficiencies, because you can get certain type of ulcers or wounds from it, and they have a very specific like presentation of it. Maybe if more scientific documents were in Comic Sans, maybe more people would study? Maybe. I feel like if this it's even oh, this is better. Ta-da! There you go. Hi, welcome, welcome, welcome. And gore, I can't. Oh no, I can't either. I've gotten like how do you call it? I don't think I could still handle gore. Cadavers still spook me out, but I think that's like a very natural human reaction of not wanting to see that. But once you worked with it, it's kind of like whatever. You're gonna continue watching One Piece? I can't believe I'll never see you again. But good luck, have fun. Thank you for stopping by. I appreciate you, Liv. Have a good one. Bye bye. Alright, so the color for arterial insufficiencies, the person might be pale or has cyanosis, which makes sense. If the blood is not able to get to the heart, like to the hand, how do you expect to see like that normal warm color that you normally see? You're going to end up with blueness because there's going to be a demonstration of lack of oxygen to that area. Now the skin can have a rubor or a dark red purplish color when in a dependent position. Temperatures can be cool and dry. The ulcers, which we were just briefly talking about, are pale and dry. Complications may be pain because of the lack of blood flow or intermittent claudication, which, to be honest, let's double check about claudication. I always get confused. I think it's something along the lines of like you put your feet down and you feel better. Yeah. Claudication refers to muscle pain due to lack of oxygen triggered by activity and then relieved by rest. So let's say you're walking and blocking, you're like, my legs hurt! Ah! But you sit and you're like, I'm good. It may be because of that. Having worked in an office with a view of the morgue, don't stay in the office past sunset? Okay, Cubs. I have a wacky story for you, okay? It's nothing spooky or anything like that. Bearcat Mountain is such a quirky place. Let me not emphasize that too much, but it is a very quirky place in the sense that they had a funeral home within a plaza, and this plaza, you can. I don't know how to say this. The funeral home was between like two fast food restaurants. And I remember when I was like in high school, I would eat at this McDonald's and I was hanging out with a friend. And we were like, oh, let's go grab some food before, you know, we study and whatever. And we're eating McDonald's in my car and we're just like looking out and we see like there's a funeral happening like right in front of us in the parking lot of the McDonald's, and we're like, I'm not really hungry anymore, are you? No? Alright, let's leave. I don't know why they thought that was a great decision. I was like, yeah, we're gonna place this right here at the McDonald's. And it's not like, oh, you can't have things across from each other. They were all in the same plaza. So I don't know. I'm firing whoever made that decision. Anyway. Do you get a Happy Meal to cheer them up? No, there's a whole group. You think I'm made out of money? You think I'm gonna buy like 20 Happy Meals to be like sorry for your loss? No, I'm sorry. Alright, some treatments or interventions to improve arterial circulation can be diet. Stop smoking! If you're smoking, stop! Statin medications encourage collateral circulation. So, you know, walk until it hurts. Stop until not hurting. Walk again. Repeat. Sorry, that sounds so caveman. Walk. Stop. Walk until pain. Stop when pain. Rest. Get up with no pain. I'm happy for your loss. Did I say that? If I said that, I'm sorry. I meant sorry for your loss. Oh my goodness. You could dangle the limb to promote circulation, so you know having gravity do its work for you. And some consequences of having arterial insufficiency is that it can be painful, loss of limbs, or life possibly, basically. Venous, so going back again to, hey, we have blood flow into our feet or into our hands. How do we get this blood flow back to our heart? That's where the veins come in. So when we have a venous insufficiency, blood is having a hard time getting back to the heart to get recirculated. The pulse can generally be pretty good, but sometimes it can be hard to feel if someone has excess edema, which again is that swelling. The skin is going to be very shiny. There's going to be edema, and it may be weeping. There might be a weeping appearance if there's excess edema, which is just indicating that there's fluid leaking through the skin. So is this a safe picture to show? Let's see. Weeping edema. Yeah, you don't want to see it, Cubs, actually. Never mind. Oh my goodness. Okay. I forget how severe edema could be, or how severe people's swellings of their leg could be. So definitely gonna be pink and reddened. So it's kind of like, well, Tippa, why was the other one pale? Remember, we're not getting blood flow to with arterial insufficiency, but with venous, we're having the opposite problem. We have so much blood. Of course it's going to be pink and reddened, and because that blood is there, it's also going to be warm. The ulcers are going to be red and draining. Complications, the edema could be chronic. You may have varicose veins or deep vein thrombosis, or maybe a pulmonary embolism from the DVT, which can be very deadly, can kill you. But to encourage venous return, we recommend walking and elevating the limb, basically again using gravity yet again to help return that blood and fluid back to the heart. The consequences? It's not really deadly, it's just more uncomfortable than anything else, so yay. Hi cute cub, hi, welcome. We could talk about lesions, but this is not something really particular for this class. Let's go back into conditions now. So I believe right now we are going away from the lungs. And I did not add this one, so I apologize. But we're going more into the heart now, and I guess with a little bit of the chest pain we are talking about, let's move over to our next heart disorder. So, pericarditis is an inflammation of the pericardium, and the pericardium is going to be, you can kind of see it here. I know it's not as zoomed in. Let's see. Oh, there you go. It's like purple lining, and this is going to be a sac-like covering in the heart. Specifically, it's going to affect the parietal pericardium, which is going to be a fluid-like membrane between the fibrous pericardium and the epicardium, and the visceral epicardium. So pericardium, basically the layer that covers the heart, is going to be affected. So similar to our other disorder, this might develop as either a primary condition or secondary to a number of diseases and conditions. So can be secondary to someone who may have influenza, a HIV infection, tuberculosis, cancer, kidney failure, hypothyroidism, autoimmune disorders, etc. Myocardial injuries or trauma such as heart attack, chest injury, chest radiation, or cardiac surgery can also cause this inflammation of the pericardium, or again, pericarditis. So how do we distinguish this from myo and cardiac infraction? So there's quite a lot, so let's talk about it. So I'm having this inflammation and it hurts. How is this not a heart attack? Well, again, this is just an inflammation and it might be replicating those symptoms, and we'll talk about the signs and symptoms in a little bit. Carmen says epi means covering and cardio means heart, right? I'm not sure if epi means covering. To my understanding, I thought epi meant above or like superficial. Shrug. I'm sorry. Like, you know, epidermis is like above the dermis, you know? But, you know, words can have multiple meanings, so it can also mean covering, potentially, but I can't confirm that. Alright. The inflamed sac may lead to accumulation of fluid. So what happens is that you're not able to have your heart fully expand. Imagine this is your pericardium and then your heart is expanding, not expanding. What's the opposite of not expanding? Shrinking? If it's inflamed, you don't want it to be really touching, and so you're not going to have that ability to fully expand the heart, and there's going to be pain when that inflamed pericardium rubs against the heart. The chest pain that's going to occur from that will mimic a heart attack because it's substernal, because of the location. It's substernal, sub meaning below, sternal referring to our sternum. Sternum is that bone in the middle of our chest that's connecting our ribs. It's going to be associated with a cough, and this cardiitis? Oh gosh. Inflammation, the pericardium, is going to radiate to the left shoulder or the supraclavicular area, which is very similar to MI. The thing is, the big thing distinguishing this is that MI, if you're having a heart attack, no amount of movement or breathing or whatever is going to relieve that pain. But with pericarditis, it's going to be relieved if you end up kneeling on all fours, if you lean forward, or if you sit upright. Different positions are going to help relieve that pain because you're moving the heart away from maybe the pericardium. And yeah, that's about it. Pericardial chest pains is often worse with breathing, swallowing, belching, neck or trunk movements, especially side bending or rotation. The pain is going to be sharp and cutting and may recur in intermittent bursts that are usually precipitated by a change in body position. Pericarditis pain may be diminished if the breath is held, because if the breath is held, that means that the heart isn't expanding, rubbing up on the pericardium. So anyway, some clinical signs and symptoms. So we're gonna have substernal pain. So substernal pain that may radiate to the neck, upper back, upper trapezius muscle, left suprascapular area, and down the left arm to the costal margins. You may also have difficulty with swallowing. Great. Pain relieves with leaning forward, sitting upright, or holding your breath can do it. While some aggravating signs and symptoms are that you may have pain with deep breathing or laughing or coughing or deep inspiration. It's also going to be aggravated with trunk movements such as side bending or rotation, a history of fevers, chills, weakness, or heart disease, cough, and lower extremity edema, especially in the feet and ankles and legs, are going to be present. You're now swallowing manually? I was about to swallow. Hey Karma, no, you are never annoying or time consuming. You're fine. Thank you. I appreciate you. There's just some questions I know I can't answer, or if I know I can answer, I'm like, we'll talk about it later. Like, it's fine. Alright, this is a chunky section about congestive heart failure, and there's gonna be a difference between left and right, and there's different symptoms, and there's pictures, and it's gonna be a lot. So let me take a quick sip of water. Yeah, hydration, for the win. FTW. And we will go from there. So let me where the heck is my water? I found it. Alright. Okay. Congestive heart failure. So heart failure is going to refer to the physiological state in which the heart is unable to pump enough blood to meet the metabolic needs of the body. Daragon, do you hate me? Do you hate me? Now I have to go grab my water bottle again. Bum. You know, I do have to catch up though. You know how I have I showed you guys this giant gallon water bottle? It has like the times, and right now I'm still at like 1 p.m. and it's already like 3:30. I need to catch up with 3 o'clock, so I guess no time like the present. Hold on. Okay, we're done. So the heart is unable to pump enough blood to meet the metabolic needs of the body, determined as oxygen consumption, at rest or during exercise, even though the filling pressures are adequate. So the heart is not pumping enough blood, but we have the right foundation for it. What's happening, or what's not happening, basically. all of this can be kind of summarized as a cardiac decompensation and cardiac insufficiency. All of that is all going to be terms related to congestive heart failure. So the heart fails when, because of intrinsic diseases or structural defects, it cannot handle a normal blood volume, or in the absence of disease cannot tolerate a sudden expansion in blood volume. Heart failure is not a disease itself. Instead, it's a term that denotes a group of manifestations related to inadequate pump performance from either the cardiac valves or the myocardium. So similar to, when people say symptoms or syndrome. Syndrome is a better term. Like, I have carpal tunnel syndrome. Syndrome is referring to the manifestations of multiple symptoms. So let's divide it out from left to right, okay? So what happens is that your heart is not able to pump blood. So what's happening on the left side? So for the left side, there's a reduced ability for the heart to pump blood throughout the body. It's weakened, and what's going to happen is that they're going to show signs and symptoms of fatigue and shortness of breath after mild physical exertion and exercise. Let's say maybe you went up a flight of steps. That's considered mild. And it's like, oh wow, I'm so out of breath. Like, oh my gosh, those stairs really took a number. We should take the elevator next time. Persistent cough, especially when laying down, because fluids move from the extremities to the lungs. You may end up with something called paroxysmal nocturnal dyspnea. Oh my, okay, we're finding the definition, how to pronounce it again. Tired of it.
Dyspnea.
Anyway, you may end up with that. You might end up with orthopnea, which is going to be the person has to be in an upright position to make sure that they're inhaling air. You may have tachycardia, which means that they have a very fast heartbeat, and it's like, but wait, why are they having a fast heartbeat if they're not even able to pump the blood? Recall that your heart is going to try to work faster to make up for that loss of the blood pumping. Fatigue and muscle weakness will be present. Edema, not just edema, the legs and ankles, and weight gain might be present, and irritability and restlessness may also occur with left-sided heart failure. There's also a drawing that you see right here. This is how the person may present. Again, that fancy word I was mentioning right up here basically is that they have trouble breathing at night. They may have coughing. They might have crackle, wheezing when you go to hear them with a stethoscope. Blood might be in their phlegm that they cough up. We talked about the fast heartbeat. They may have restlessness, confusion. Must be upright to breathe. Shortness of breath when exercising, fatigue, and you see how blue he is as well? It's also going to present with cyanosis. Uncle B, what is this? Is it the glasses? Is it the glasses adding like a +5 to my cuteness factor? I do agree. They do add something. Hi Miku, hi, welcome. Anyway, so with right-sided heart failure, we'll go look at an image as well, but what's going to happen is that that's also going to be weakened. But with the right side, it's not about pumping, it's now just swelling. It's the accumulation of fluids in there, and from that you're going to have signs and symptoms such as increased fatigue, dependent edema, which is going to begin at the ankles, pitting edema, which is something I have like a little chart on. We'll look at it in a little bit. Edema in the sacral region, so the back, like your tailbone, in that area, and in the back of the thighs. Right upper quadrant pain, and we'll talk about quadrants. Oh god, we'll talk about them because I gotta memorize it in a few hours. And you may also have cyanosis of the nail beds because again, it's that blood not being able to pump. So now we have this other cute drawing. So again, fatigue, ascites might be present, so this is like a swelling of the abdomen, enlarged liver and spleen, maybe secondary to chronic pulmonary problems, anorexia and complaints of GI distress, weight gain, and then dependent edema, which is like there's a city and the edema is accumulating. Is it constipation? No, it's heart problems. They have congestive heart failure, but it can vary from left to right. So for the left one, again, this is going to be usually caused by hypertension, coronary artery disease, or CAD, and valvular disease. So this is going to be divided into two other subtypes for the left congestive heart failure, and this could be systolic heart failure or diastolic heart failure. Again, the same thing with the symptoms about the cough, crackles, etc., tachycardia, fatigue, cyanosis, and exertional shortness of breath. For the right side, this is going to be caused by left ventricular failure or a heart attack on the right side, or pulmonary hypertension, also known as that cor pulmonale that we were talking about earlier. The right ventricle of the heart cannot empty completely, which is why we're going to have this swelling, and this may be secondary to pulmonary problems, such as your COPD. Symptoms again is peripheral edema, so that's swelling, ascites, the enlarged abdomen that I was just talking about, enlarged liver and spleen, jugular veins distension, weight gain, and increased peripheral venous pressure. So let's talk about pitting edema, okay? After this, wait, I thought they were holding their chest when it comes to heart problems, but Uncle keeps seeing their intestines in sitting position. Oh, no. So conditional heart failures, yeah, they're just gonna be in wacky sitting positions. You're thinking like more like a myocardiac infarction or heart attack where they grab onto their heart and they're like, Anyway, so edema. So there's actually a scale for pitting edema, and pitting edema again is going to be a symptom that we're going to see in the right-sided heart failure. So again, what's going to happen is it's basically your body's swelling, so you have all these squishiness and the fluid accumulation. There's different ways that we could determine it. So if you press down on the skin and there's no indentation, congratulations, there's no pitting edema. When you get to 1+, it's mild pitting edema. So there's a 2 millimeter depression that will disappear rapidly. 2+ is moderate, so 4 millimeter depression that's going to disappear in 10 to 5 seconds. 3+ is moderately severe, so there's definitely a more impressionable indentation. 6 millimeters, and that depression is going to last more than a minute, so you press down and you let go and there's still an indent a minute later. And then severe is going to be, you can super squish it, 8 millimeters, and it can last up to more than 2 minutes, which is crazy. So 1 again is when you can see it for a few seconds. 2 when it's less than a minute. 3, or sorry, let me actually read it. Let's not do it from memory. 1 is going to be a few seconds. 2 is going to be 10 to 15 seconds. 3 if it lasts more than a minute, and 4 if it lasts for more than 2 minutes. So da-dang. I know Chinese acupuncture trick. Stroke the vein behind the neck to lower blood pressure. Not sure if it works. Oh, ear to neck? Potentially. I don't know, I feel like that'd be relaxing, I'd be like, oh wow, I'm so calm. Alright, Cubs, the whatever people say as like the top meal that they were waiting for. Bon appetit. Let us talk about myocardiac infarctions, aka heart attacks or coronary occlusions. So what happens is that an MI is a development of ischemic and necrosis of myocardiac tissues. Ischemic means that they're not getting enough blood pressure. Necrosis means that it's dead tissue. This is going to result from a sudden decrease in coronary perfusion or an increase in myocardiac oxygen demands without adequate blood supply. This is serious in comparison to anything else that we talked about because there's going to be damage in the heart tissue with an MI. An MI may occur during exertion, exercise, exposure to extreme temperatures, or you know what? Heck all that. It may just occur when at rest. If the requirements for blood are not eased, for example, decreased activity, the heart attempts to continue meeting the increased demands for oxygen with an inadequate blood supply, which is going to lead to MI. let me reread it because I kind of read through it and I was like, what did I just say? Basically, if you're working really hard and your blood's not able to meet it and you're not slowing down, your heart's going to continue to try to match up with you, but it doesn't have the foundation to meet up with you. So what's going to happen is that you end up with that heart attack. Death generally results from severe arrhythmia, so abnormal rhythms of the heart, cardiogenic shock, congestive heart failure, rupture of the heart, and recurrent MI. So people can have multiple heart attacks. It just kind of keeps getting worse and worse because what happens again is that you're going to have that damaged heart tissue, and you don't want your heart muscles and heart tissues to be damaged. Alright, so you see the tightness or pain in chest, and that's when the person grips. There's a blockage, lack of blood supply, heart attack. Ta-da! So one heart attack can last weeks? That's crazy. I didn't know that. I was like, what? So some clinical signs and symptoms of a heart attack is that it may be silent. You know, silent but deadly. Just like, anyway. This can happen in smokers or people who have reduced sensitivity to pain. Remember, because smoking is going to restrict your blood vessels. It's going to make them smaller. There could be a sudden cardiac death, a prolonged or severe substernal chest pain, squeezing pressure, pain possibly radiating down from one or both, and or up to the throat, neck, back, jaw, shoulder, or arm. So it's just a typical radiation pattern for MI that we had talked about briefly for like males especially. Feelings of nausea or indigestion, angina, which is that acute chest pain that may be lasting for 30 minutes or more. The chest pain that you're feeling, the angina, is going to be unrelieved by rest, medication such as nitroglycerin, or maybe I meant to write antacids. Heck. Pain of infarct unrelieved by rest or change in position, so it's not anything like pericarditis. Nausea, sudden dimness or loss of vision or speech. Pallor, so again that paleness. Diaphoresis, so sweating. Shortness of breath. Weakness, numbness, and feelings of fairness. What are feelings of fairness? Faintness. Holy heck, I'm like, fairness. So let's talk about the difference between men and women when it comes to heart attack presentations. You feel fair? Bas, are you feeling bonita? Cause you look So men with heart attacks, basically, they may appear with a pressure / a discomfort under the sternum, mid-chest or upper chest. There could be pain in their jaw, upper neck, mid-back, and it goes down to the arm. And that pain from the jaw, upper neck, mid-back, and down to arm can appear without chest pain or discomfort. That pain can radiate from the chest to neck, jaw, mid-back, arms, and it radiates in both arms, or the radiation to both arms is possible, and the left arm is most affected. The pattern's in an ulnar nerve distribution, so it's going to affect half your ring finger, your pinky, come up all that side of your hand, and all that side of your arm. You're going to have pain from there as well. Hi Monte, hi, welcome. The fair condition. The fair assessment. Cubs, please. Alright, women on the other hand have a heck ton of ways that a heart attack can present, which is really not in the way that you would expect. So women may present with symptoms that are more atypical or subtle. So chest pain is actually less common in women. They're going to have a heaviness, a squeezing, or pain in the left side of their chest. Abdomen, they can have pain in their mid-back, shoulder, or arm with no mid-chest symptoms. So imagine having random pain somewhere else and it's like, yeah, my shoulder hurts. And it's like, yeah, you're having a heart attack right now. Like what? Women may have a prodromal symptoms. Prodromal is referring to the onset of psychosis, which are symptoms that are going to affect the mind, and that could be symptoms that are going to be up to 1 month before having the heart attack. So this lady might go crazy and it's all because of a heart attack. Fatigue or lower abdominal pain may signal an MI, but to be honest, this is something that's normally shrugged off because it's like, brother, my tummy hurts. I am a tummy ache survivor and this hecking hurts. So maybe it could be passed off as the flu, like, you know, oh, I maybe whatever, or food poisoning, like, oh, I ate something bad. I just won't eat there again. They may have intense anxiety, isolated right bicep pain, mid-thoracic pain, heartburn, shortness of breath, inability to talk, move, or breathe, shoulder or arm pain, ankle swelling, and rapid weight gain can all be signs of a myocardial infarction, which is crazy. So, excuse me. With that in mind, we're going to move over to the gastrointestinal disorders. This is something I definitely need to work on, so we're going to be focusing on that if you don't mind. You have all those right now? Baz, please. Like a Tipanya, a bearcat of science and modern medicine. The bearcat we need in our lives. Let's go! I'm gonna be a very productive member of society, helping people. Yay! Dies. So smart. So PhD certified. Brother, I'm not getting my PhD unless I absolutely need to. Unless it's like, oh, you need this for teaching. I'm like, oh, I kind of want to get into teaching. I guess I'll do it. You're gonna go run an errand in the gym? Absolutely no hecking worries. Atomic, thank you so very much for stopping by. Good luck with the games. Have fun and love life. Imagine a bearcat in a lab coat? Brother, I've been in a lab coat. I'm in a lab coat for all my practicals. I was in a lab coat on Saturday or Sunday. Yeah. Alright, every cup. We are at page 27 out of 72, which is horrifying to think about. But we are studying, I think, like the latest or last chapter of my exam because it's only chapters 6 through 9. Nice. But let me take a little baby break because I did chug some water. And I will explode, which apparently Cubs have told me that I can't just use that for content. So I will politely BRB, stand up and stretch, because we've also been live for almost 2 hours, and I've also been speaking, I feel like, for an hour and 40 minutes straight. So a little baby break for that too, you know? Something I want to be a teacher? Don't teach in them high schools? I won't, I guess. Huh? Huh? What? Anyway, don't explore for content? Fine. Anyway, I'll politely BRB! Ta-dang! What's happening? What's happening? Baz, you don't have anything? What the heck? What's happening? Rip is weaponizing the Gao economy? Holy heck. Hold on, you gotta fix that really quick. Welcome back, thank you. Thank you. Oh my goodness. Wait. Hold on. I'm letting Baz live out his dreams. That's all. Good luck, Baz, out there. Good luck. May you win 20-fold. I don't know what the math is to that. Come on, Dream Elements, don't be a butt. I want to see Baz win. Here, what is 69 times 20 anyway? 69 times 20. Alright, Baz, go for it. No, Baz, no! It's okay. No! It's over? But why is it being a butt for you? Oh my goodness, holy heck, hold on. BK, hi, welcome. Oh my goodness, how are ya? We're just trying to fix the Gao economy really quick. Wait, what's happening? Hold on. You're also getting this amount. Gosh darn it. I'm fixing the Gao economy little by little. Thank you for the headband. Thank you. Thank you. The headband made me win. Yay! The Gao economy's not in shambles. Yay! Hats. It's okay, Baz. I did the math. I got you. 69 gals times 20 is 1,380. So I put all my faith into you, and I had a backup plan. So here you go. Those are your gals. Yeah, boy. My gals aren't worth anything. No, the number I have right now is just a flex rip. Your gals mean something. Your gals are your participation here, and I appreciate it. And I appreciate you. I appreciate you so much. You're gonna get a fancy shout out. That's a very little thing to show my appreciation. I forgot to do the shout out while I was BRBing, so this isn't an economy class anyway. It really isn't, and to be honest, I didn't really care for economics. So. Anyway, let's talk about diverticulitis. You know that's not how you say it. Diverticulitis. Yeah, that's probably how you say it. Ta-da! Look at that! That could be your intestines! Inflamed! Awful looking! But it's a benign condition which the mucosa or the lining of the colon? Huh? Balloons out to weaken areas of the wall. And so what happens is that these pockets are going to become inflamed or infected. And people over the age of 65%, up to 60% of them have sac-like protrusions. And normally this is something asymptomatic, so they're not showing any symptoms. Which is why it's very important to be screened for colon cancer. But this is really common for people who use and abuse NSAIDs, the oh my gosh. I don't remember what NSAIDs are. Non-steroid anti-inflammatory drugs. Oh my goodness. I can look. Listen, I haven't taken the pharmacology yet. Don't bunk me for not knowing basics. Huh? Do you date economics or economics or economics? Ay caramba. I like the economics. I think that would be fun. Hang out with bats, be like, ooh, how do the echo waves sound right now? Sound pretty good. Oh, nice. Anyway, signs and symptoms of diverticulitis is that they're going to have generalized abdominal pain, often with a loss of appetite, nausea, and abdominal bloating. What's going to happen is that these people who have this, colon issue are going to present with issues with the left lower quadrant pain, and that's going to be present into about 70% of patients. In less cases, what's going to happen is that there's going to be a right lower abdominal pain, but most commonly it's left. There can be a decrease or absent bowel sounds, and there's going to be a palpable abdominal mass. Signs and symptoms, maybe they'll have flatulence, so maybe they're passing gas, and bloody stools are also very common for people like that. Constipation or irregular bowel movements, urinary urgency, frequency of the colon near the bladder is affected, and a low-grade fever may be present but not necessarily always. So let me show you the quadrants really quick. I don't know much about this pinch-and-inch test though. Imagine homeschool kids start watching VTubers as a source of education. I could start my own teaching business? Eventually. Not really. I thought it would be really cute to open up my own clinic, but then I was like, that's a lot of work. For who? For what? Alright. Oh, I don't have my quadrants here? Oh, I do have my quadrants. So here's the 9 quadrants that, how do you call it? That can be present. And so we're saying that they're going to be present with left pain, because we see the descending colon right here, but they also be present with right quadrant pain. So that might not be the best image. I don't think maybe I have like the 4 quadrants, but basically think of the belly button, draw a horizontal line, vertical line, and then it's either left or it's right. And it's kind of like Tippa. Why does it say right when it's on the left side? It's all about anatomical position, unfortunately. So yeah, that's why you would have the pain there. But let's go back up and let's go to Crohn's disease. Can you say hypogastric? I already had my Dora the Explorer segment yesterday. I should have clipped it. Now I have to go back to the VODs. Woohoo! Woohoo! I'll link it to you when I remember. When I remember to clip it too. I think it was like towards the end of stream, so it should be kind of easy to find. Alright, Crohn's disease. So this is also something you may have heard, Cubs, as well. Crohn's disease is actually a benign condition in which... I don't have Crohn's disease! Alright, does my classmate have Crohn's disease and they figured it out? Yes, they do. Alright. I'm gonna steal their thing really quick. They also have something else too. They even have a pen. Hold on. I'm just stealing. Oh no, that has. I'm just stealing all of this now. I'm sorry, classmate of mine. I don't know if it's stealing and if we both stole each other's thing. Like, this is my chart, but I definitely did not write the right information in there. Alright, we'll put it here. Hi, Weeb. Yeah, hello. Welcome, welcome, welcome. How are you? I hope you're doing super, 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 super well. Ta-da! Alright, Crohn's disease this time. Inflammatory disease that most commonly attacks the terminal end or distal end of the small intestines, which can also refer to the ileum and the colon. It can occur anywhere in the ailment canal from the mouth to the anus. It appears at any age, but it's most likely to develop in persons between the ages of 20 to 29. Also may appear in those who have a family member, sibling, or parent with IBD, which is irritable bowel disorder, and smokers. So some signs and symptoms for Crohn's disease, because again we're going to have the abdominal cramping and pain as well as the inflammation and scarring in the intestines, is that acute manifestations may occur, but the condition is usually slow and pretty non-aggressive. Mild intermediate symptoms months before the diagnosis is made. Fever may occur with acute inflammation, abscesses, or rheumatoid manifestations, and terminal ileum involvement. So there might be pain in the peri-umbilical region with possible referred pain to the corresponding segments of the low back, Pain of the ilium is intermittent and felt in the lower right quadrant. And possibly associated with iliopsoas abscess causing hip pain. Sorry, this is all new information to me. Experience relief or discomfort after passing stool or farting, basically. That's why it's important to ask whether the low back pain is relieved after passing stool or gas. So, let's see. I wish there was something else I can check out, but I guess I'll note it. Farting. Yeah. So what is this? Hold on. So curious. Psoas abscessus is a rare medical condition that is defined as a painful collection of pus in the psoas muscle of the spine, located in the lower lumbar region of the spine. This muscle extends through the pelvis to the femur. Most commonly results as a direct extension of intra-abdominal infections such as diverticulitis, Crohn's disease, pelvic inflammatory disease. I don't remember her talking about GERD. Okay, so the reason why my study guide and my classmate's study guide is a little bit different is because he ended up getting tutor notes, apparently, about DD, and I'm like, oh, that's really exciting. I'm glad. But a lot of the stuff from the focus sheet that she gave us is missing. We feel like it's just missing a lot. And we're like, okay, well, we'll just focus on what she gave us. But he had put notes from the tutor, so he's like, anything highlighted in yellow is what the tutor said to focus in. So I'm like, okay, I'll take it. So let's focus on these and then we'll get back into charts and disorders. Once we're done with all this, we'll do some questions and we'll do it together. And hopefully it would still be a reasonable time before the exam. Yeah? Yeah. The exam, by the way, is at 7, and right now it's 4, so I still have 3 more hours, right? Yeah. Anyway. Let's talk about GERD. Gastroesophageal reflux disease. So GERD typical symptoms are heartburn, regurgitation with bitter taste in mouth, and belching, like bleh. Atypical symptoms are going to be chest pain unrelated to activity, sensation of a lump in the throat, difficulty swallowing, painful swallowing, wheezing, coughing, hoarseness, asthma, a sore throat, laryngitis, weight loss, and anemia. Problems related to this backwards movement of the stomach acid and other stomach contents such as pepsin and bile to the esophagus, a phenomenon called acid reflux. Normally, some gastric contents move or reflux from the stomach into the esophagus, but in GERD, the process becomes more pathological, producing symptoms that point to the tissue's injury in the esophagus and sometimes the respiratory tract, usually caused by the intermittent relaxing of the lower esophageal sphincter. All I got was acid reflux. Oh wow. Peptic ulcer. Peptic ulcer is a loss of tissue lining the lower esophagus tissue and duodenum. Duodenum. Oh heck! I forgot. Hold on. My phone was dying. I was like, oh no, let me go charge it. One moment. Let me get a picture really quick. Wait! No! Totally no! I see you! Nanami, hi! Thank you so very much for the raid! Cubs, you know what to do. Ham smashterators to hecking heck! Oh no, I want to show you a prettier... Oh, what's pretty? Oh no! There's nothing pretty here! No, nothing's pretty! Anyway, welcome raiders, welcome. Thank you so very much for the raid. I hope your stream went super well. My name is Tipanya. I'm a bearcat VTuber. I do the gal and nya, and it's very nice to meet you. Sure, cats, I got you. Oh, I don't have cats here. Let's see. Where do I have cats right now? I have to go to my other. You'll just have to like pretend, okay? So. I'm sorry I'm not set up here right now, but just pretend that I am here. And then here are all my cats. Thank you for coming to my tip talk. Thank you, and goodbye. But how was your stream? Thank you again. Totally, hi, welcome back. Primrose, hi, welcome back. Oh goodness. Snackle, hi, welcome back. Nanami again, hello and welcome. Thank you so much for the Alright, thank you. Thank you for the follow as well. Welcome to the Cup Club. Welcome. Sorry, I had the separate screen when I actually do like Pomodoro. For now, I'm over here. Thank you, welcome, and thank you cuz for defending the fort. I appreciate ya. Welcome. Origin, hi, welcome as well. So cute. Yes, Peas, my cat, my beloved. There's a little Peas painting mode if you can see it. It was very good. Thank you. Absolutely glad to hear it. So as you see, kind of definitely studying. I have an exam at 7 today. I normally do some Pomodoro streams, so it's like 45 minutes of focus, 15-minute breaks, and we do like a little chatting and everything like that. But for today, I'm basically just politely regurgitating my notes. And so a lot of it's just medical and like finding wacky things, like we were talking about, like mild cardiac infractions, which is just a fancy way of saying heart attack. And right now we're on like things like Crohn's disease and not hepatitis. Where were we? I got so panicked. GERD. No, we're on peptic ulcers now, but I feel so bad because I hate just reading blocks of text, but I just copied this from my other classmates' notes, so I'm kind of like, oh, we'll just have to read through this together. I'm sorry, Cubs. But Primrose, thank you so very much for the follow. Welcome to the Cup Club. Welcome as well. I don't know how long you're streaming, so feel free to take a break. Yes, please do go ahead and rest. Make sure to hydrate, eat something super yummy, and just relax. Again, I'm glad you had a good stream, and I hope to catch you next time. Okay, let me make sure I catch you next time. Balls. But thank you. Nana's the bestest, by the way. I believe it. But please have a good night and the sweetest of dreams if you're also going to bed. Big nighty-night. Oh, nighty-night to you too, totally. Nighty-night. Oh my goodness. Good night and sweetest of dreams to you as well then. Rest well. Oh my goodness. It's only 4 o'clock here in Bearcat Mountain. I keep forgetting about time zones. Oh my goodness. Enjoy. I was just about to grab a photo of peptic ulcers, which is not something I think everyone would be super excited about, but definitely cool imaging to be like, whoa, that's my stomach, I guess. Let's see, we'll put them right here, okay? A heart attack is a minor cardiac infraction. I assume a major one just explodes? Oh, it sounds like myocardiac. Cardio infraction. Sorry, there you go. I typed that. I'm like, ooh. Totally says it's midnight and I have an exam in 2 days? Well, good thing you have 2 days to cram. Go. But yeah, I guess if it is a major one, it just explodes. It might as well. But sorry, not minor or mild. Mild. My voice is dying. I'm sorry. Myocardiac infraction. Muscle of the heart infraction squeezing. Anyway, peptic ulcers. So it's a loss of tissue lining of the lower esophagus, stomach, which we see here, esophagus up here, stomach here, and duodenum, which is a part of our intestines. Gastric and duodenal ulcers are considered together in this section. Acute lesions do not extend through the mucosa are called erosions. Chronic ulcers involve the muscular coat destroying musculature and replacing it with permanent scars. Blah 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 blah. Ulcers can be dangerous if left untreated, eroding into the stomach arteries and causing life-threatening bleeding or perforating the stomach and spreading infection. H. pyloric-induced ulcers can reoccur after treatment. The reoccurrence rate is higher in clients with gastric ulcers, and in people who smoke, consume alcohol, or use NSAIDs, the non-steroid anti-inflammatory drugs. A past medical history of peptic ulcers in anyone with a new onset of back pain or shoulder pain should be a red flag. So again, that's going back to our referred symptoms. So let's talk about some clinical signs and symptoms, okay? Peptic ulcers, you may have a heartburn or epigastric pain aggravated by food, hence the gastric ulcer, or it could be relieved by food, so like milk, antacids, oh goodness, or vomiting can help relieve. You might have night pain, apparently specifically midnight to 3 a.m. And it's going to be the same relief for epigastric pain. You may have radiating back pain, stomach pain, right shoulder pain, lightheadedness or fainting, nausea, vomiting, anorexia, weight loss, bloody stools, or black tarry stools. Oh, okay. Let me quickly skim through the NSAIDs because I don't think they're as important. Okay, it goes back to peptic ulcers. Appendicitis. I'm surprised. Do I not have it already in here? Yeah, I have a dedicated appendicitis. But we can briefly look at it a little bit if that's fine. And then we can refresh it once we get down there. Hi, wait. Hi, Starbucker. Hi, welcome. I meant to say Karma. Thank you so much. I will get it in 3 hours. I got it. But no. Hi, Starbucker. Hi. Welcome. So studious, so smart. All the gal-gals and me losing my voice for speaking for so long. I'm gonna die. Dies. Let me give you a shout out though in the meanwhile. Starbucker TV. Did I spell it right? No, I didn't spell it right because I had my eyes closed. Ah! Anyway. No! I put the colon! Copy and paste. Dies, Lasai. Dies a cringe. Haha. Honey, I got the heartburn. Get the... Huh? Emetic? Huh? Emetic? Huh? Calling me a bucker? No, I'm calling you a hecker. I'm gonna die of cringe right now cuz I have to get through this. I mean, it would be right of me to die before an exam, but we're not doing it today. Alright, so emetic is used to induce vomiting. Oh. You know, funny enough, we were just talking about vomiting in yesterday's stream. Why were we talking about that again? Oh no. I was like, I don't need anything to induce vomit anymore. I just have to like stick my head in a toilet and be like, wow, that's really gross. Anyway, can I go look? Yeah, no problem. Please make some really good fried rice. Have lots of fun. I appreciate you. Thank you for stopping by. Thank you for the look as well. Thank you. Alright, so appendicitis. Some clinical signs and symptoms and we'll look at. No, well, we'll get there when we get there. I have something for UC. I have something for irritable bowel. I'll come back to it. Let's talk about hepatitis though. So hepatitis is going to refer to an acute or chronic inflammation of the liver, and this can be caused by virus, can be caused by chemical, a drug reaction, or alcohol abuse. This could be secondary to diseases such as infections with other viruses such as the Epstein-Barr virus or the cytomegalovirus. So some risk factors to have hepatitis is that maybe it's injection drug use, acupuncture, a tattoo inscription or removal, so anything basically dealing with needles, ear or body piercing, recent operative procedure, liver transplant blood or plasma transfusion before 1991, hemodialysis, healthcare workers exposed to blood product or blood fluids, exposure to certain chemicals or medications, unprotected sexual activity, severe alcoholism, travel to high-risk area, or consumption of raw shellfish. There is a wide variety of how you can get wacky, acute, or chronic inflammation of the liver. Let me just politely scroll back down. So you heard of different hepatitis. There's like A, B. I think there's also C and D, but we're only going to be focusing on A and B. I've highlighted like the unique characteristics between the two, but I'll still read them all with maybe some emphasis. So hepatitis A is going to have extreme fatigue, anorexia, fever, basically generalized aching, right upper abdominal pain, clay-colored stools, dark urine, jaundice, headaches, pharyngitis, alteration in sense, of taste and smell, Loss of desire to smoke cigarettes or drink alcohol. Kind of sounds like a positive. No, I'm just kidding. Anyway, low-grade fever and indigestion. Varying degrees of nausea, heartburn, and flatulence is going to be part of that. Blackbird, hi, welcome. I had jaundice as a baby. Bro, I was a little Simpson? You were. Jaundice is so spooky because you have to look up jaundice. It's not spooky in a sense that's scary, but it's crazy to see how yellow people can be. And I'm used to only see jaundice in like the people's like eyes. So like, you know, our eyes are white. That is the color I would associate it with. But people with jaundice tend to have yellow, like yellow eyes. But some people can also present with yellow skin, hence the little Simpson comment. But it's so spooky. Have you seen blue skin? I haven't, but that's definitely a thing right now. Doctors are now recommending hepatitis A to reduce smoking. Let's go! Yeah, I would not. Anyway, good thing I'm not a doctor though. Who would have guessed it was scurvy? What are you, a pirate? What's happening? Why didn't your parents give me vitamin C? Or an orange? Like, hello? Blue skin from handling too much silver, I think? Oh, I think I heard of something similar to that. I don't... Oh, yeah. I'm like, I don't remember the name of the condition. Yeah, no, that's spooky too. Having different skin color? Spooky. Sorry, like abnormal skin color. Correction. Like a yellow or a blue. Anyway, so hepatitis B is gonna be jaundice with only pain in the joint. There is, what do you call it? Hepatitis B may present with a rash over the entire body. They're also gonna have dark urine and anorexia. And nausea is gonna be exclusive to hepatitis B. Painful abdominal bloating is also going to be present with B, as well as a fever. I wish, maybe, you think there's a cute image out there to tell me the difference between hepatitis A and B? Hepatitis A and B. No, but there's charts. It's like, oh, show me another chart, and it's like hepatitis A, people who use drugs, people who are experiencing homelessness. Hepatitis B, people who inject drugs. And I'm like, I guess they're not like wrong. I just wanted a cute like diagram. Gosh darn it. It's okay. It's really not that serious. Let's say it's not that serious. Unless I did find my cute. I found it, I think. Let's go. Hepatitis A is spread through fecal or oral. So basically you have contaminated food or drinks or close contact with an infected person. Hepatitis B is exposure to blood or bodily fluids. Could be childbirth, unprotected sex, or sharing contaminated needles. Let's go. Eh? Which can get from getting bit by a dude? Wait, you got bit by a dude and got scurvy? Is that your lore? Is that what happened? I'm sorry. That's such a need in modern education. We need more cute diagrams. I know, like, how am I supposed to learn? My work used to give us hepatitis B shots. Yeah, hopefully not from the same needle. But yeah, please get vaccinated for very preventable things. Please and thank you, Cubs. Alright. Anyway, the world's blurriest diagram of the same thing about hepatitis A and B. Yeah, look, literally in the end, B is with bloating and has like a different way of getting it, of having that acute or chronic inflammation of the liver. Yes. Hence hepatitis, hepa referring to liver. Okay, we're done. Alright, spider angiomas. These are going to be red spots on the skin, and they normally occur when a small cluster of blood vessels come to the skin surface of the skin. Who wrote this? Anyway, the blood vessels may branch out, giving the spot a spider-like appearance, and then this is really common with people who may have cirrhosis, which we'll talk about in literally just a moment, alcoholism, or in pregnant women. I think my classmate might have another thing about it though. You didn't get bit? How did you get scurvy then? Yeah, these are the only two things then. There's so many liver things related. It's scary. It's horrifying. Alright. Cirrhosis. What happened? There you go. So cirrhosis of the liver, it's a chronic hepatic disease. So another liver disease characterized by the destruction of liver cells and the replacement of connective tissues by fibrous bands. So what's going to happen is, as the liver is going to become more and more scarred or fibrosed or however you want to say it, the blood and lymph flow that goes over there is going to become impaired, which means it's not going to work as well, causing hepatic insufficiency and increased clinical manifestations. And though the cause of cirrhosis may be varied, it's most likely due to alcohol abuse, at least in America. USA. Anyway. Some risk factors are mild right upper quadrant pain, which can become progressive, GI symptoms, so any like my tummy hurts, anorexia, indigestion, weight loss, nausea, and vomiting can also be risk factors, or sorry, signs and symptoms. Ooh. Dull abdominal ache, ease of fatigue with mild exertion, weakness, and fever can also be present. For cirrhosis, let's see what else we have. Oh, it has the spider adenomias again that we were just talking about earlier. But basically, TLDR, you drink a lot, your liver gets more fibrous, and it just impairs flow, and that causes all this hecking business. What pain did we say? We said it was right upper quadrant? Yeah. So again, this is still not the quadrants. Like, this is not the 4 main ones I'm looking for. These are the 9, but again, right here, and we understand because we have the liver here, we had the liver here, we had the liver here. Our liver is so big for goodness knows whatever reason. I'll try to find like a better picture. Let's see. 4 quadrants abdominal. I'm a social drinker, but I haven't socialized in a while, so I'm a lightweight. Listen, I cannot drink. I mean, I don't have like an intolerance or anything like that, but like, I am also a social drinker, but I also don't drink really while socializing either. I think I drink more at cons than anything else. I go to cons like 2 to 3 times a year. Alright, I just want to find a picture that shows me the liver, because I think that would be pretty pog. Our livers are huge, I think, because we eat other livers? Livers? Maybe. Alright, so liver, stomach. Liver's huge. So this is like the summary version of why they keep saying like upper right quadrant, da 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 da. This is not the 9. This is like more generalized. So if we further divided this, this is where we'll get our 9 abdominal quadrants, and we're saying that the liver extends from 1, 2, and 4. Not accurate exactly, but you get the idea. Alright, so with that, let's talk about appendicitis. So appendix, very fun, wacky. Can we see it here? No, but we could see it on the right iliac. It's on the right side. Appendicitis is going to be an inflammation of the appendix. You ever hear about like appendix rupture? Well, there you go. So this thing is going to occur mostly in adolescents and young adults. It's a serious disease that is usually requiring surgery. When the appendix becomes obstructed, inflamed, and infected, rupture may occur, leading to peritonitis, which is just a fancy way of saying redness and swelling of the lining of the belly of the abdominal. So the swelling and all these symptoms of appendicitis might be actually mistaken for Crohn's disease, which remember we talked about with that having very similar issues, but again the pain is relieved with passing stool. This could also be mistaken for perforated duodenal ulcers, gallbladder attacks, and kidney affection on the right side. For women, they believe it could be a ruptured ectopic, oh my goodness, pregnancy, a twisted ovarian cyst, or a hemorrhaging ovarian follicle during the middle of their menstrual cycle. So basically, appendicitis is kind of a hacker to try to diagnose because it can be confused for a lot of things, but once you find it and once you have the signs and symptoms correct, they will do their best to remove it, you know? So I just read that, Karma. I was like, what? Oh my gosh, my uncle had a very serious case. He died during the surgery and got reanimated, and now he has a 2-year-old daughter. I'm glad that your uncle is safe. I was just hearing about someone earlier who's like, yeah, I had to do the surgery and I flatlined on the table, and I'm like, you what? They're like, yeah, I died, but I'm back. I'm like, that's so scary. I think surgeries can be scary in that very reason. There's always a risk with anything, I guess. Anyway, appendicitis. You can have periumbilical or epigastric pain. So what does that mean again? So periumbilical can also be referred to as epigastric. And what was the other one? Heck. Epigastric. No, then what's periumbilical? Anyway, never mind. They can have center pain, so periumbilical, umbilical referring to the belly button, or epigastric pain, which is going to be above that. We also can have right upper quadrant or flank pain. We can have right thigh, groin, or testicular pain. Abdominal involuntary muscular guarding and rigidity. Can have a positive McBurney's point or positive pinch and itch test. So McBurney's we'll talk about just in a few moments. They can have rebound tenderness, which would be more indicative of the peritonitis. They can have a positive hop test, so this is hopping on one leg or jumping on both feet. They may reproduce painful symptoms. They can have nausea, vomiting. They could be anorexic. They can have dysuria, which is painful or difficult urination, low-grade fever, or coated tongue and bad breath. So McMurray's point is basically, so if you were to grab onto your hips, right? And you feel the what do you call it, bump, like you can grab onto your iliac crest, like your hip bones, right here. Well, if you let your fingers fall in the front and you use like your index or middle finger to palpate or touch, you'll feel a bony prominence, and that's called the ASIS. So in between that structure that you just felt coming off from your hips and feeling that bony prominence from your belly button, you want to go like 2/3 the distance or something like that and press down. And when you press down and then quickly release, that's supposed to be McBurney's point, and this is supposed to be an indication of appendicitis. So ta-da! I've never heard reanimated used in that context. I love the sound, like it sounds like a mummy coming back. Just a little bit, just like reanimated. Yeah, it's still really spooky. Yeah, I died, but I lived. So wicked. Oh my goodness, we have so hold on, 1, 2, there's so, oh wait, no, we don't have that many more. We can do it, Cubs, we got this. Hey, and there's pressed down once and I tooted. That's okay, that's fine. There's worse things that can happen out there, you know. No, anyway, IBS, so irritable bowel syndrome. So irritable bowel syndrome, or IBS, can be referred to as the common cold of the stomach. So this is a functional disorder of motility, so movement, in the small and large intestines. This one's really interesting because guess what? People could be like, ow, my tummy hurt. But there's no cause for irritable bowel syndrome. This is classified as a functional disorder because abdominal muscle contractions that is identified with people with IBS cannot be attributed to any identifiable abnormalities of the bowels. So all those other conditions we were talking about are their own conditions. IBS, there's no reason why you should be having motility issues. But they believe what happens is that IBS is often associated with psychosocial factors. So history of mental, physical, or sexual abuse can be quite common. This may also be associated with disturbances in the circadian rhythm. So some signs and symptoms that you may have IBS is painful abdominal cramps, constipation, diarrhea, nausea and vomiting, anorexia, flatulence, and foul breath. Alright, let's keep talking about organ gastrointestinal stuff. Let's go! So we have chlorocystis. Okay, let's find the definition, or let's find the pronunciation. Pronunciation.
Cholecystitis.
No way was I gonna ever say that. What? Hold on, I lost the tab.
Cholecystitis.
Cholecystitis. Okay, so hold on. Cholecystitis is a blockage or impaction of the gallstone or of gallstones and a cystic duct, which are going to lead to infection or inflammation of the gallbladder. So we have our gallbladder right here. Might be a gallstone that blocks the cystic duct, and basically we're going to have that infection and inflammation. This could be acute or chronic, causing painful distension of the gallbladder. So distension again is that like ballooning up, and the individuals may feel steady, severe pain that rapidly increases in intensity, lasting for several minutes to several hours. The gallstones may be from the chronic disorder, and what happens from there is that the gallbladder may atrophy. It may basically waste away, and when it wastes away, it becomes fibrotic, and when it's fibrotic, it might adhere to adjacent organs. So it's not really unusual to have repeated episodes before seeking medical attentions of, hey, I'm having this pain right here, basically, and right here referring to the gallbladder, which is in what quadrant? The right upper quadrant! Yay! We can see it in that picture here. Remember, using our belly button as a reference, we use our imaginary lines to make these 4 quadrants, and we can see that it's in the right upper. Now, this is where I said I was going to lose my motivation to type out, so let's read the acute and chronic, but give me one moment as I'm losing my voice somehow. I'm not going to make it come. One moment. I am hydrating, hold on. I am gonna pause to check, hold on. Wait, hold on. Yes, I'm dying. Let me hydrate more. I Belair than you? Hi, dingus. Welcome, dingus. Hold on, dingus. I just have to let those few demons out, you know, my inner demons. But thank you for the hydrate, thank you for the posture check, and I will inhale air. Anyway, you're good? Good. Okay, I'm good. I have to do that too. Wait, that sounds more like constipated than anything else. Never mind, the demons are out and I'm hydrated. That's all that matters, right? You got this, Tipanya. I believe in you. Thank you. Thank you for believing or believing in me. I appreciate it. Huh? She's I want to read that word as exercising so bad. She's demon expelling. It's so hard right now. Okay, anyway. Thank you, homie. How's the studying going? It's going surprisingly okay. We only have a few more disorders before I move on to some questions, and life will be good. I hope can only hope for so much right now. And that is one thing I'm hoping for. I'm not too worried about this exam, in a sense that if I do decide to like absolutely like fail it, I did get an A in the last exam, so the average will be okay. But excuse me, my burp demon came out. But would like to pass. Would like to have a vague idea of what I'm talking about, you know? Reanimate, reanimate, reanimate! Breathe air? Thank you. You got this, homie. Proud of you. Thank you. I just have to make it through today, and tomorrow, and Friday, and the week after, and then the week after that, and then... yeah. You know, after this chaotic week when I can like relax, maybe starting the 25th, looking at my calendar, I just have to worry about finals, which won't be until... hold on, I'm breaking out the calendar. Oh, sorry. Yeah, my next exams after this month would be the 2nd of August, and then I have finals starting the week of the 14th, so yay! Yay! Exciting! So cool! Wow, Tippa, we love higher education for you. School's a scam. No, I'm kidding. Let me not say that. Did I tell you, Cubs? I did say that too. I was catching up with a friend I hadn't seen in many years, and I'm like, oh, I'm so sorry. I meant to say that my program tuition is $100,000 for just the 4 years alone, and I've never had to pay $100,000 for a degree before, so I felt like it was a scam. He's like, can't say that. You're gonna discourage people from going to school. I'm like, oh no, I'll encourage any Cub to go to school. Yeah. 100% emoji. Go to school, get your education, and live a decent life and make nice double-digit money, you know? But, like, gosh darn it. I'm stuck working, so I'm gonna lurk a little bit, so I'll be here. Absolutely no hecking worries. Thank you for stopping by. I appreciate you. Thank you. So many exams and projects, I will cry. You know, I felt so bad. This is so personal. I'm sorry for like dumping this. I wanted to cry. When I had learned about like me having to do the retake, and then the stress about like that's not one more exam out of the way, it's one additional exam that I've added. I wanted to cry, and then I keep just stopping myself. I'm like, brother, just cry. And I'm like, I can't. There's no time to cry. So I'm just like, okay, that's fine. Anyway, Trace says, if you don't do well, I'm writing your school a very heated letter. Please, I would appreciate it. But I'm doing okay, honestly. 100,000 through how many years? 4. But there's other programs that are offering like for 60,000, and technically my program's not even supposed to be a doctorate. Everywhere else outside of the US, I mean everywhere, international, even Canada, what do you call it? They my degree is a bachelor's. It's a 4-year degree, which I could have done for very little money. Still no fun with that, it isn't, but it's okay, we'll manage. Okay, so acute situs. So for acute, remember we were talking about this having the infection because the gallstone's getting stuck in the gallbladder, and they're gonna have that right upper quadrant pain. So what's gonna happen here for acute is that they're gonna have chills, a low-grade fever, they're gonna present with jaundice, so that yellowing of the skin and eyes, GI symptoms, nausea, anorexia, vomiting, tenderness over the gallbladder, tenderness to the tip of the 10th rib, called the hot rib, which... sure. Severe pain in the right upper quadrant and epigastrium, and pain radiating to the right shoulder between the scapulae. For chronic, if this is going to be vague, or sorry, these may be vague, or a sense of indigestion and abdominal discomfort after eating unless a stone leaves the gallbladder and causes obstruction in the common duct, called that. Biliary colic, oh my gosh. Unless the stone leaves the gallbladder and causes obstruction of the common duct, which causes biliary colic, which is going to be severe, steady pain for 3 to 4 hours in the right upper quadrant. Pain may radiate to the mid-back between the scapulae. So imagine this organ, this gallbladder, is causing mid-back pain, or mid-upper back pain, I suppose, because it's between your shoulder blades. Nausea, abdominal fullness, heartburn, excessive belching, and constipation and diarrhea. So Let's talk about peptic ulcers again because, gosh darn it, did we talk about it before? But let's make sure we double it down, okay? Hot rib sounds tasty. BRB, opening up a restaurant, being like, ooh, this is hot rib. So peptic ulcers are going to be the loss of tissue lining the lower esophagus, stomach, and duodenum. Gosh darn it. Anyway, gastric and duodenal ulcers are considered together in the section, so we know the acute do not extend through the mucosa and that these acute lesions are going to be referred as erosions, while chronic ulcers involve the muscular coat, destroying musculature and replacing it with permanent scar tissue at the site of healing. Some clinical signs and symptoms again are going to be heartburn, night pain, radiating back pain, stomach pain, right shoulder pain. Common, very, very common to have right shoulder pain, and it's like, oh no, but it's just ulcer. Lightheadedness or fainting, nausea, vomiting, anorexia, weight loss, bloody stools, and black tarry stools. This is just a diagram to show you different ways that you can get an ulcer. Very common spots, basically. Let's talk about colon cancer! Alright, so colon cancer also can be referred to as a colon rectal cancer. Is a growth of cells that form in the lower end of the digestive tract. Most of these cancers start as non-cancerous growth called polyps. Removing polyps can remove cancer, so healthcare providers recommend screenings for those at high risk or over the age of 45. So, big thumbs up emoji. Make sure to get screened for stuff, okay, Caps? Especially if you hit a certain age. Okay? Okay. Some signs and symptoms. Early stages, you might have rectal bleeding, so your booty bleeds, or you might have hemorrhoids. Abdominal, pelvic, back, or sacral pain. You may have back pain that radiates down the legs, and you may have changes in bowel movements. Maybe you poop more, maybe you poop less. Advanced stages of colon cancer, however, you may have constipation progressing to obstipation, which that sounds horrifying, so we'll look it up together, okay? What is it called? Obstipation? Obstipation is one step further than constipation, and is characterized by the inability to pass the accumulation of dry, hard feces. This can cause impaction of the entire length of the colon and lead to permanent damage. Yeah. Diarrhea, a copious amount of mucus. Oh, that's spooky. Nausea, vomiting, abdominal distension, so your abdominal is swollen. Weight loss, fatigue, and shortness of breath. And fever, but fever is less common for those in the advanced stage. Let's talk about UC, ulcerative colitis. So this is going to be an inflammation and ulceration of the inner linings of the large intestine and rectum. So if it's only referred to rectum only, it's actually referred to as ulcerative proctitis. But UC is actually not the same as irritable bowel syndrome or spastic colitis, which is another term for IBS. Colorectal cancer is more common among those who have conditions resulting in inflammation. Why is colon cancer brought up here? Hold on. Okay, the incidence is greatly increased 8 to 10 years after being diagnosed with UC or Crohn's disease, that you may have colorectal cancer if you may have this inflammation and ulceration of the inner lining of the large intestine or rectum. So, signs and symptoms as always. Da-da! Diarrhea, constipation, fever, abdominal pain, rectal bleeding, night sweats, decreased appetite, nausea, weight loss. Ew. Sorry. Excuse me. Night sweats, decreased appetite, nausea, and weight loss. Skin lesions. Inflammation of the eye, hello? Arthritis, migratory, and hip pain. Yeah, unfortunately, I'm digesting my salad because I wanted to eat healthy, but you know, I actually saw Someone who made like the spinach artichoke dip, and I'm like, you know what I crave? Greens. I crave vegetables. So I got a little salad. I'm like, oh my goodness, this is so tasty. Yeah, I think it's just here, but they're lurking, so. No, Carmen, no! Carmen, no! Anyway, let's talk about ascites and portal hypertension. And why would this occur? And this occurs because of portal hypertension. And remember, ascites is that thing that is a buildup of the abdominal region. Da-dang. Do I not have a cool picture of it? Guess not. Alright, this is basically gonna be our second to last one, so let's stay strong, okay? So ascites is well, actually, you know what would be really cool? I think this one has more of an effect if you could see it. I could tell you all day, like, ooh, big tummy. You want to see ascites? You want to see it? I got you! Yay, ascites! Portal hypertension refers to elevated pressure in the portal vein through which the blood passes from the GI tract and spleen to the liver. No, I should read it. Elevated pressure in the portal vein occurring as portal blood meets increased resistance to flow in the fibrotic liver. The blood then backs up into the esophageal, stomach, and splenic structures and bypass the liver. And then you end up with, I guess, ascites. But I don't really have like a thing, so let's see. That's me after Korean barbecue. Same. It's so full. But this is full in the wrong way. So let's see if my classmate put more information. I'm not really seeing it, but we do know the build-up, so that's what matters, I guess, right? After that, it's just cranial nerve testing, which I'm not gonna get into. I'm so sorry. We should talk more about this, but I feel like this might be more memorization on my end. So let's try to do some questions, and then if we have time, we'll write through some stuff. Is that okay? This is the not as fun stuff. What time is it now though? It's 4:47. 8. I might BRB really quick. Might BRB really quick, and we could do these questions in a little bit. And yeah, we'll get through them, and we'll try to learn like the reasoning. And let's see. 9. Are these all questions? Okay, and there's like 10 pages of questions. These questions are questions that my classmate got from the back of the textbook, so it's nothing like wacky. Oh my goodness, and the work is now messaging me too. Heck! Huh? There's some gas. Hey? Gas top on the drawer for the gases? Exactly. Alright, give me one whole hecky moment, okay? I'll be right back. Ta-da! But sorry about that. Again, work was like, did you do this? And I'm like, what do you mean? I didn't have that. And they're like, oh. And I'm like, oh. I'm like, well, I could do it tomorrow when I'm at my work computer because I don't have access at home. So let's see how that goes. Hopefully it's like some weird like misunderstanding. But anyway, thank you for welcome back. So I appreciate it. Thank you. And Takuni, hi, welcome as well. Welcome. Congratulations on the gambling. Let's go. Even though I think gambling's bad. I think the BRB gambling is always very fun. Don't fall into habits though. Anyway, let us get started with the questions today. So our chapter 6 again was dealing all about like respiratory issues. So let's see if we can use our big brains and try to remember things even though the answers are right here. Ba-bum. So pursed-lip breathing in a sitting position while leaning forward. Hold on, sorry, let me get closer to my computer and use my special eyes. Pursed-lip breathing, so the little kissy face breathing, like you know, we go, but now hold it together and try to blow in and air in and out. So that kind of breathing, and the sitting position while leaning forward on the arms release symptoms of dyspnea for the client with orthopnea, emphysema, congestive heart failure, or D, A, and C. So it definitely will be B because we talked about emphysema being like the no, we talked about emphysema being the pink puffers. A, orthopnea refers to the they're having shortness of breath or they're not able to breathe if they're laying on their back. And congestive heart failure, I don't really think they have a problem with inhalation of air. Excuse me, sorry, I felt like I was gonna like hiccup again, so I'm like, my voice. Alright, briefly describe the difference between myocardial ischemia, angina pectoris, and MI. I could try to explain it. Myocardial ischemia is just lack of blood supply. Angina pectoris is going to be acute pain in the chest, and MI is your heart attack, so that can lead to damage to the heart tissue or even necrotic tissue. Yeah. Alright, so let's read what it says. Myocardial ischemia is the deficiency of blood supply to the heart muscle that is usually caused by the narrowing of coronary arteries. Angina pectoris is the chest pain that occurs when the heart is not receiving an adequate supply of blood and therefore has insufficient quantities of oxygen for the workload. Myocardial infarction is death of the heart tissues when blood supply to that area is interrupted. I think my answer is pretty accurate, minus me kind of like completely forgetting the adequate supply for the angina, but that's fine. What should you do if a patient complains of dropping pain at the base of the neck that radiates into the interscapular regions with increased exertion? Do you think that's the exertional angina, like the unstable one we were talking about earlier? Let's see. Monitor vital signs and palpate pulses. Evaluate past and current medical history for the presence of coronary heart disease. Any suspicion of thoracic aneurysm must be reported to the physician immediately. It is beyond the scope of PT's practice to suggest the possibility of an aneurysm. Rather, clinical observations should be documented and submitted to the physician. A summary content can be made such as, the clinical presentation is not consistent with the MSK problem. Please evaluate. What are the 3 P's? I've never heard of the 3 P's in my life, so we're gonna read that one. Pleuritic pain, exasperated by respiratory movements involving the diaphragm, such as sighing, deep breathing, coughing, sneezing, laughing, and or the hiccups. This may be cardiac with pericarditis, or it may be pulmonary. Have the client hold their breath and reassess symptoms. Any reduction or elimination of symptoms with breath holding or the Valsalva maneuver suggests a pulmonary or cardiac source of pain. If there's pain on palpation, it's a musculoskeletal origin. If there's pain with changes of position, It could be musculoskeletal, or it could be pulmonary origin. The pain that is worse when lying down, that improves when sitting up or leaning forward, is often pleuritic in origin. Okay. What are palpitations clinically significant? May be considered physiological when in normal limits. When they occur at a rate of less than 6 per minute. Palpation. A 48-year-old woman with TMJ syndrome, so temporal mandibular joint syndrome, has been referred to you by her dentist. How do you screen for the possibility of medical, specifically cardiac disease? Oh, remember one of them had like a toothache as one of their symptoms, remember? No, I don't remember which one it is. Let's see. Toothache. Oh, angina. Okay. So we could check their past medical history by personal or family history of coronary artery disease, heart disease, angina, MI, or risk factors. Assess menstrual history. Menstrual-pausal or postmenopausal women are at a higher risk of heart disease, and they may develop symptomatic coronary artery disease. Clinical presentations. They don't seem consistent. Associated signs and symptoms. Look for nausea, the unexplained sweating, the paleness, the pallor, shortness of breath during painful or systematic periods. Sorry, some of these questions are not like, they're good, but they're not like the questions my professor would ask, so that's why I'm not like too worried, or I feel like I could easily like skip through it. Hi Rose, hi, welcome. Hi Tippa, hope you can fix all my lung and gastro disorders after today. I don't have any, I hope. Are you experiencing toothache, chest pain, nausea, pallor, diarrhea, vomiting, anorexia, weight loss? Any of those? Alright, if you are, go to your doctor. I'm not a doctor. Google said I'm dying. I'm sorry. So many things? It's so many, isn't it cool? No, it's not. I wish everyone like a happy, healthy life. Please. Please live. Anyway, a 55-year-old male grocery store manager reports that he becomes extremely weak and breathless when he's stocking groceries on overhead shelves. What is the significance? The onset of MI can be precipitated by working with the arms extended overhead. Great, now you can't work overhead. Your heart will say no. Alright, ischemia or infarction may be the cause of the client's symptoms. Assess for history of heart disease and presence of hypertension, angina, and past episodes of heart attack or congestive heart failure. Okay. You're assessing an 83-year-old woman for home health evaluations after a motor vehicle accident that required a long hospitalization, followed by transitional care in an intermediate care nursing facility. Alright guys, this is screaming hospital-acquired pneumonia. She's ambulating short distances with a wheeled walker, and she's becoming short of breath quickly and requires lengthy rest periods. At each visit, the client is wearing her slippers and housecoat, so you suggest that she starts dressing each day as she is intended to go out. She replies that she can no longer fit in her loosest slacks and she cannot tie her shoes. Is there any significance to this client's comments, or is this consistent with her age and obvious deconditioning? No, actually, never mind. This is referring to now maybe more right-sided congestive heart failure. So you're supposed to examine the client for present cyanosis, orthopnea, and tachycardia. Look for changes in renal function. Decrease urination during the day but frequent at night, and for spasmodic cough triggered by lying down or at night. It may be indicators of congested heart failure. Let's go! And must be reported to the physician. Take note of whether your client is taking NSAIDs. Okay. See, these are the questions I want. Peripheral vascular disease includes arterial and occlusive disease, arterial venous disorders, chronic and acute arterial diseases, all the above, none of the above. To be honest, I wouldn't have known if it wasn't bolded. I would have picked like B or something, but I guess it is all the above. For a second I thought it was saying she doesn't know how to tie her shoes. Yeah, she's old. She might have forgot. Karma's like, I swear she'll say let's go to a patient one day. I am still slightly embarrassed at the time I yelled like let's go to one of my much higher supervisors. Not like let's go, but one of our clients, I guess, didn't appear, and that was my only like case for the day, and and they're giving me the news, and I'm like, oh, let's go. And they looked at me, but this was the guy described as a weird owl. Like, he looked like a weird owl, and he was chill like that, okay. But he's definitely much ranked in life, much higher ranked than me in the hierarchy of work. Let's go! I don't have to work, and I get paid for it. Let's go! It's because I have a weird contract job that I only get paid if by the number of cases that they give me. So womp womp. And if someone doesn't show up, I still get paid. Let's go! You know, the job is actually making me think that my body's deteriorating because my thumb started hurting. And I'm like, I don't know what's wrong with my thumb. I should, but I don't know. Heart failure, let's go! No, I feel so bad. Apparently there's stages of heart failure. And I don't know. Again, organs are not my strong suit, so we won't go into it. But I think it's very spooky to not just have like your heart fail. It's like, oh yeah, there's stages. I'm like, what? If your heart fails, your heart fails. I don't have stages of failure. But it's fine. It truly is what it is in this heck of a earth. So let's continue on, okay? Which of these statements is the most accurate? I'm just going to read the correct one. Arterial diseases is characterized by painful dropping of the feet at night that goes away by dangling the feet over the bed. So this makes sense because remember we were talking about arterial diseases and arterial insufficiency, and that remember our arteries' responsibility is to bring blood away from the heart to our extremities and to, well, the rest of our body. Yeah. That's still the case here with arterial diseases. So if it's having a hard time, you know, going to different places, let's just use gravity. So if you dangle your feet, gravity will bring the blood and it'll pull it towards your feet. So ta-da! That is why C is correct. You know what's actually really interesting? Let's talk about D for a little bit. D says arterial diseases is characterized by a loss of hair on the toes. Let's stop right there. So guess what? That's not wrong. I learned, Cubs, if you have like a hairless area of your body, you might not be getting blood flow to that area, or like proper blood flow. And I don't think that's anything like super serious, like, oh, this. And obviously genetics does play a part to some things, like, oh, this is why I don't have chest on my hair, or something like that. But my teacher had told me again, you need blood flow, you need nutrition to get hair growing, so that's why you may see people with like these bald spots. I too don't have chest on my hair. Oh, did I say chest on my hair? Hair on my chest. I'm sorry. Listen, I've been speaking for 3 hours. As someone who doesn't speak normally and only speaks rarely at work. Not rarely, I have to speak at work. And only for stream, it's very hard to socialize. You need to eat. You know, I'm actually kind of full, to be honest. I could get like a little snack. This is where I bring out the boba. I start making my Thai tea again. How to stimulate blood flow to the beard? Let's go. You're gonna go bald? No! No, I'm sorry. Here we go. We'll look it up later, I promise. We'll figure it out. But that is just something she told me. I thought that was just interesting. So what are some primary signs and symptoms of congestional heart failure? It's gonna be fatigue, a shortness of breath, edema, and nocturia, which is gonna be that whole difficulty breathing at night. Let's go. When would you advise a client in PT to take his or her nitroglycerin? Please take your nitroglycerin as soon as the chest pain begins. Do it for Marshall? Please do it for Marshall. Marshall's bald. There's nothing wrong being bald, okay? That's it. I can't say anything for like the conversation because I don't feel like I'm a good voice or speaker for that. You know what I mean? I got hair everywhere else. It's just physically impossible for it to grow. I'm doomed. Oh no. Time for a new quote on the server? No. I forgot we have a quote channel. I'm like, let me look. Oh gosh, darn it. Don't update it. It's been a year. Let it die! Anyway. So right now we're going into chapter 7. So now we're going to be talking about... Actually, I don't like this one as much. No, maybe I do. It's just there's some things that I'm like skimming through, like, no, we didn't talk about that. This can be okay. Like the presence of persistent dry cough with no phlegm or sputum has no significant no clinical significance to the therapist. True or false? If someone's having persistent dry cough, it does have significant clinical significance, so this is going to be false. However, medical referral is not usually considered necessary when a patient presents with a singular systemic sign or symptom, especially in the presence of a clear clinical presentation of an MSK pattern. Shortness of breath associated with emphysema is the result of what? And so dyspnea is the result of destruction of the oh goodness gracious. And my music stopped? This is a sign. Hold on. Oh, it came back. Cool. Alveoli? Reduce elasticity of the lungs and an increased effort to exhale trapped air. All those are going to be associated with those who are having shortness of breath along with emphysema. Ta-da. Thank you for the quote, I guess, as well. And let's see. The presence of pain and anxiety in a client can often lead to hyperventilation. When a client hyperventilates, the arterial concentration of carbon dioxide would do one of the following. Decreases? Huh. Yeah, I don't feel like chapter 7's questions did it any justice. Let's go chapter 8, finish it, and kind of maybe call it a day. I'll probably study a little off stream, just like little Quizlets or review stuff that we haven't talked about, but I'm feeling pretty okay. I like the way you made it look bald. Sorry. It like it says extra punch. Yeah, it is just the all caps. Do you really want an edited symbol right there, SG? Don't you want to keep it original? Now it looks like you're gonna fluff up and fake information. Wow. Anyway, so chapter 8 is dealing more with the GI. So, bleeding in the GI tract can be manifested as melena. Melena, I felt so bad because, what do you call it? I thought it was such a pretty name, and then I looked it up, and it literally means like blood and poop. There's like no other definition for it. And I'm like, what about names like Melanie and all that stuff? Like, does that come from that? Where does it come from? Hi Buster, hi, welcome! Not gonna lie, lung and gastrointestinal disorder studying is kind of a vibe. Let's go! Thank you, I'm glad that you're appreciating the vibes. I really do appreciate it. Oh my goodness, welcome to the Kukla chat. I promise I do more than studying. I can provide the chill, cool vibes. But mostly this is my life now. Thanks, school! I did realize my music did change, so give me one moment. Ta-da! Added another one for the books? What? Wow! Thank you, Ashi. I appreciate you. I think. Hey? Melina's mane? As in lines hair in Spanish? No, but oh my goodness, hold on. Let me get it. No. So
Melina.
oh my god, that was so loud. Melina, dark sticky feces containing partly digested blood. Like any other like definitions or words? No, that's literally what it means. So now I feel like a little bit bad. I'm like, okay. Every time I see some variation of that name, I'm just gonna think, oh yeah, blood and stool. Thank you for the inhalation of Aridim. I will gladly take it. Thank you. What is the significance of a curse sign? So this is something we should look up a little bit because I'm not sure how to replicate curse sign. Let's see. Curse sign is the occurrence of acute pain in the tip of the shoulder due to the presence of blood or other irritants in the peritoneal cavity when the person is lying down and their legs are elevated. Curse sign in the left shoulder is considered a classic symptom of a ruptured spleen. Huh. Hey, if nothing else, then I'll make it really hard to forget what Melina means. No, I won't forget it. Again, I thought it was so pretty, and then I like looked at the definition. I'm like, oh god. So curse sign again is if it's associated with shoulder pain, it means ruptured spleen, and if it's ruptured, that means all these things are coming out. So it just kind of adds on to the idea of it is gas, air, blood in the abdominal cavity. So what are areas of the body that GI disorders can reference pain to? And it can reference pain anywhere. I would love to show you like a pain pattern reference. Unfortunately, it shows like a silhouette of male genitalia. So I'm like, I don't think that's safe for Twitch. So we're not going to do that. Alright. Let's see. A 56-year-old client was referred to PT for pelvic floor rehab. His primary symptoms are obstructed. Oh. Someone else is here, heck. Obstructed defecation and puborectalis muscle spasm. He wakes nightly with left flank pain. The pattern is low thoracic laterally, but superior to the iliac crest. So it is like low rib cage, but above the hip bone. Sometimes he has buttocks pain on the same side. He doesn't have any daytime pain, but is up for several hours at night. Advil and light activity do not help much. The pain is relieved or decreased with passing gas. He has very tight hamstrings and rectus femoris. Changes in symptoms with gas and defecation is possible with blank. Buster Freeze, thank you so very much for the follow. Welcome to the Cup Club. Welcome, 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 welcome. If pain's relieved or decreased with passing gas, definitely an intestine issue. No and ifs or doubts about that. Very long case for a very simple solution. I don't think there's like any like more emphasis I could put, like, oh, your pain decreases while passing gas. Yep, intestinal issue. Please leave. Oh, they're adding more details. Okay, what is the significance of a psoas sign? So psoas sign is going to indicate the infection of the peritoneum, which can cause abscesses formation of the psoas, which we did read earlier about it being like a really rare thing of that there can be pus forming on your muscle, and goodness gracious, you don't want that. Like at all. But the peritoneum, oh, it's just the infection. Sorry, this is referring to the serous membrane lining of the cavity of the abdomen. Your tummy, basically. There's like a little lining. I forget there's 2 layers, and it's just saying that the significance of this is going to be the infection of the abdominal thing, and again, that's going to lead to the abscess formation, that pus on the psoas, or it can apparently be also on the obturator nerve. So this is going to result in right lower quadrant pain, abdominal or pelvic pain, and association with specific movements of the right leg. And there's different ways we can test this by it doing different motions. We can recall that our iliopsoas is our hip flexor, so it definitely has to be some kind of motion like that. Alright, which of the following are clues to possible involvement of the GI system? Abdominal pain at the same level as the back, occurring either simultaneously or alternatively. So I think the best example of this is, I wonder if I have it, shingles? So this is a person with shingles. It's a very contagious, like, listen, I'm not a doctor, but, so let me get like the actual definition, but it's a highly infectious disease. Shingles is a reactivation of the chickenpox virus in the body caused by a painful rash. Anyone who's had chickenpox may develop shingles. It isn't known what reactivates the virus. Shingles cause a painful rash that appears as a strip of blisters on the trunk of the body. Pain can persist even after the rash is gone. Treatments include pain relief, antiviral medications, a chickenpox vaccine in childhood, or shingles vaccine as an adult can minimize risk of developing it. So get your vaccines. Thank you. Good night. Taz, thank you so very much for the follow. Welcome to the Cup Club. Welcome. So this kind of goes hand in hand with the idea of that question we just saw, that it's following the same pattern of the front and back. Shingles come up and it's following that dermatonal pattern from here, and it's also exhibiting here. So ta-da! Alright. A 65-year-old client.
I've been waiting
Oh
for
no!
this.
Oh no! Hi! Cause you know what to do. Hand smash raiders, hacking hack! Oh my goodness! Welcome. Thank you so very much for the raid and welcome, raiders. My name is Tipanya. I'm a bearcat VTuber. I do the gal and yan. It's very nice to meet you. It's so rare to catch you. I feel like I've been catching you way in the morning, so I'm like, you're still streaming? You're streaming so late. What the actual heck? But thank you so much for the raid. Welcome in. We're just studying right now. I have a test in like 2 hours, and I promise they didn't look as dry. They were prettier. We had colorful notes. We were like, ooh, this. But right now we're just doing questions off like another classmate's worksheet. So apologies. I promise I do more than studying. I also game. I'm a gamer. But thank you. How is the stream? How is the arting? Nasby, by the way, thank you so very much for the follow. Welcome to the Cup Club. Welcome, and Ghosty Queen, thank you as well. Thank you. And Robo, thank you for giving us such a book. Babby and Alex. Wait, Babby, what? Babby's here too? What the hecky? But Nasby, hi, welcome. Mihukoro, hi, welcome as well. Welcome. Wolverine, hi, welcome. Babby, hi, welcome. Thank you, Cups, for defending the fort. I appreciate it. Ghosty, hi, welcome as well. Politely schooling. I hope studying is going well. It is. My fellow PT, let's go. I'm learning about, what do you call it? Differential diagnosis. So it's the whole idea of like, oh, you're having cursite? Your spleen is ruptured and that's why you're having left shoulder pain. Go see your doctor. That's not me. Oh no, did you not find any weaknesses from our insides? You gotta know your enemy from the inside in. Not that you're my enemy, but in case. Wish you all the best. Thank you, I appreciate it. I have so many exams this week. I have one today, tomorrow, and Friday, and then I have 2 next week. So I quiet every single day, but the crying is for later. Like I said, I normally feel like I catch you in the morning, so I'm like, did you stream for a very long time today? Holy heck. No matter what, thank you so much for the raid. If you have to go or if you want to look absolutely a-okay with me, make sure to hydrate and eat something super yummy. And thank you again. Hydrate, I got you. Thank you, Ghosty. I appreciate it. I am dying of hydration. And my big water bottle. Da-dang! Thank you for the likes. I appreciate it. Please have a good look and thank you for hanging out. I appreciate it. Thank you, Ghosty. Thank you, Nasmi. Thank you. Oh yeah, it is Mr. Streamer. Oh my goodness, welcome to the Cup Club. Bobby and Alu, welcome. Enjoy the emotes. Enjoy the Cup Club. We are very friendly. Until we're not. No, I'm just kidding. I've never had a problem. Anyway, sorry. One more hydrate, okay? And then we'll get back to the questions. Okay. Nice. Alright. No, they're adding questions. Okay, this one's definitely not it. So we're gonna keep reading. I'm gonna keep skimming through. And I think these are all like the lengthy ones that really do not matter. But let's do this one because it looks important and it touches on the subjects that I feel a little bit weaker in. Excuse me. Oh my goodness, drinking water is getting my digestive system going. Holy heck. Alright, so question number 1. So, referred pain patterns associated with hepatic and biliary pathology conditions produce musculoskeletal symptoms in the what? So, again, referred pain again is like, oh, organ hurty, but even though that's hurty, it's referred pain to somewhere else. So, if we have a hepatic or biliary pathology, so hepatic, wait, hold on. Alex, I gotta be lurking. Gonna get something to eat and study with you. Oh no, you're gonna refresh what I learned over here. Let's go. All right, that's absolutely no hacking problem with me. I am a-okay with that. Please eat something super yummy, and then we'll politely refresh together. Okay? Okay. So, remember, hepatic is gonna be in reference to liver. Biliary is what do you call it? Escaping me, so I should probably politely look that up. The bile duct. Okay, so the gallbladder, and we talked about that earlier, like the green structure. You know, it's actually funny. It's actually really green. Like, they don't color it like that just for funsies. It's actually green in the body. Anyway, so if you have a liver or gallbladder pathology, these pain that you may be having may refer to the mid back, upper back, scapula, or right shoulder region. So, what is the sorry, again, it's a shared document. What is the mechanism for referred right shoulder pain from hepatic or biliary diseases? How about the same question? Why does someone with liver dysfunction develop numbness and tingling that is sometimes labeled as carpal tunnel? This was the result of pneumonia abnormality and peripheral nerve disease with numbness and tingling in hands and feet that could be misinterpreted as carpal or tarso. Hold on. Sorry, not for anything. Again, some of these questions are from the book, but that's not necessarily how my professor goes about it. So cover your eyes, cuz as I politely try to speedrun reading this really quick and seeing what they're adding first of all too. No 4 stages or stages of hepatitis. What? We already stages. We know A and B. I didn't know there was more than that, you know? Oh my goodness. This is something that I'll have to probably refer to. And just a little bit. Just a tiny little bit. Let me see. Anything else that's new and cool that I should probably look at really quick? I gotta go, just got off work, but hope your exam goes well. Thank you, I appreciate it. Thank you. You'll do my absolute best. Good job at work today. Good job working hard. Good job. Drive home safe. Love life. Pick up some nice dinner. Unless you already had dinner in the fridge, then go eat. And thank you for hanging out. I appreciate it. Thank you. Weave says, we can't even trust our own bodies considering how capable they are of attacking themselves. Don't get me started on autoimmune diseases where the body attacks itself. Bye-bye. Thank you. Oh my goodness, Cubs. I don't know where to go from here. I feel like some of the stuff that my beautiful classmate put is a little too extra. I was just gonna see on the focus sheet. Let's sigh. You want to try to see if we could do Quizlets or something? Or maybe I should try to catch up with the 9 regions. Let's try Quizlets. I just don't know if there'll be any good ones. I know that sounds a little bit weird. My classmate was very nice for linking some, so why don't I pop a few of those up? I'll quickly BRB just to get that set up so you don't see me struggle. And we can do some flashcards together, really quick. And then I'll skip the questions that are we won't get that. And then we actually do get it. I'll be like, oh, we didn't really talk about that. Yeah, I think it sounds like a plan. Also, I could do another raffle. So, BRB! Where's the education? The education's right here, my dude. BRB. Is the BRB not big enough? Anyway, I'm back. I set the Quizlet, and life is good. Alright, so I have a few that we'll try to get through. This one is probably the more straightforward one. This one has about 40 questions, while the other ones are more chapter focused, and they have like maybe like over 100, which not really fun, to be honest. Sorry, I couldn't see on the tiny screen. I'm like, is this good? Is this bad? Heck. Don't know how big to make it, you know? Anyway, so let's do this one because I think this would be beneficial. I did try to skim through the other ones, and some of them are just not relevant to what we've learned, so I think we'll do what we can, at least in the next less than an hour. I don't know how long the Quizlet section will take us, but I feel pretty okay, and I feel like if I stare for the remaining time at my guide without boring you cubs, I think it should be okay. Hopefully, gosh darn it. Yeah, let's get started on possible quiz questions. Let's go! Alright, a truck driver was diagnosed with bilateral carpal tunnel syndrome. Oh heck, we just read that and I completely ignored it. He has a history of alcoholism and right upper quadrant pain. Which of the following is most likely? So, if he's having right upper quadrant pain, what structures are there? And that's going to be the most important thing to kind of think about. So, I want to say it's hepatitis. Because your pancreas... Hold on. I mean, your pancreas... The head of the pancreas is technically over there. No. A? Okay, A. Oh, okay. Good. It's the alcoholism that should have gave it away. Thank you. We got this one though. Which of the following is most likely to cause gastrointestinal bleeding? Is it NSAID, smoking, pulmonary embolism, and tuberculosis? So I'm definitely going to say A. I've seen so many, and I think literally one of the disorders we looked about, I don't know if it was diverticulitis, was like literally contributed to like overuse of NSAID. So let's flip. Let's go! Okay. Chest pain resolved by leaning forward is an indication of what? A. Myocardiac infarction. B. Pericarditis. C. Pancreatitis. Or D. Aneurysm. This is going to be B. Pericarditis. Remember we talked about that one, and this was the what do you call it? The inflammation of the heart layer. How do you call it? And this is the one where you lean over, or this is the one where they try to get on all fours and they're like, yeah, I feel a ton better, and I'm like, you do you. No, it's okay, Carmen, no, but let's flip it anyway. Alright. Pursed lips breathing in the sitting position while leaning forward on the arms release symptoms of dyspnea for the client with what? So, I'm actually a little confused. I won't lie, I did go through this because I kind of know a little bit about it, but that might be cheating. The document that my classmate had with questions said that this would be B, but I think this one says all the above. I'm not exactly sure what is the correct answer. I can kind of justify A, orthopenia, because this is again the whole like they're having trouble laying on their back, and then when they get up they're able to, they don't have any trouble breathing anymore, so putting them in a sitting position would be neat, but I don't know if like anything else would be like needed or extra, you know. We'll skip that. This one we definitely saw, so I'm just gonna politely characterize of saying that it is the arterial disease. It's C. Arterial disease is characterized by painful dropping of the feet at night that goes away by dangling the feet over the bed. Again, what do you call it? Arterial disease or insufficiency, having difficulty getting the blood to different places, so let gravity do the work for it. Ta-da! Where's the pain with right-sided congestive heart failure most likely to present? When I stared at this question, I'm like, oh, I'm overthinking it. So if it's right-sided heart failure, I'm so used to everything in anatomy being the opposite side, so I'm like, oh yeah, left. No, but this one is going to be the right upper quadrant, so this is going to be B. Your patient presents with pitting edema. You observe a moderate indentation of approximately 4 millimeters that disappears after 15 seconds. What score would you give using the pitting edema grading scale? So this one's very interesting. This was the picture I had showed. So 15 seconds. I think it might be 2. Because 0 was no pitting edema. 1 was, I think it disappears in a few seconds, and I think 2 was 10 to 15. 3 would be over a minute, and 4 would be over 2 minutes. So, ooh, what answer did I put? I said 2. Let's go. Right, madam. Alright, your patient presents with pitting edema of gross distortion of the limb. You observe an indentation of approximately 8 millimeters. And it disappears after 3 minutes. So again, what they're doing is that they're pressing down into this swollen, filled with edema, like leg. Let's just use the leg. And they're pressing down on it, and this indentation staying there for 3 minutes. That's crazy. So what score would you give it? I would definitely give it the highest score. I'd give it a 4. Da-dang. Alright, what else is cool and new with the world? Da-dang. Your patient presents with pitting edema. Wow, so many patients. You observe an indentation of approximately 6 millimeters that disappears after about 1 minute. What score would you give this one? Ta-da! The Wii. Ta-da! Bearcat school facts in real life time? Really? You're a very popular doctor? Oh, I love my congestive heart failure patients. When a blood vessel becomes blocked with a clot, it's called what? This is going to be referred to as C, thrombosis. Da, da. But hi, welcome. Sorry, my brain like stopped. It's like, huh? Which population is at the greatest risk of coronary artery disease? This is going to be D, older black women. Alright. A patient with moderate intensity tightness and chest discomfort lasting about 5 minutes after exertion is most likely experiencing what? I'm going to politely say, angina. Ta-da! I can't wait for Tippa to have one of those cute nurse outfits. I want one! Wait, should I dig through Booth and like get one? Should I be like a redeem? I was joking around with Cal because we were talking about Higurashi, and if you're familiar with the nurse there, we're like, was her outfit always like that? Let me pick up a picture so the cubs who are unfamiliar, like, was Miss Takuno's outfit always like that? Now this is fan art, but hey, that's fine. No, you have to believe me though, even if it's fan art. No, okay, but wait, this is the actual cover of the book, so... Hold on. Next outfit? Like, baby version of it. Ta-da! I was like, no way, that's been her outfit. Like, we've only seen her from the top up, so I'm like, no way they put this in the anime. She's not a real nurse. And then this is the fan art that I was referring to. Ta-da! So cute. I don't know, I think their outfits are actually very cute as well. So, ta-da! If I find something, I'll humor you cubs. Alright. So, a patient with severe... We said that was it. Oh, I skipped it. Oh, I like that, right? Isn't it cute? But we were like so shocked. I'm like, oh, the skirt is so short. It's sweating. Trey says you're learning Spanish? Eventually. It's not my, what do you call it? Primary goal right now, unfortunately. I didn't imagine anything too saucy. So those are pretty? Yeah, let's go! I couldn't. I already feel like nervous with anything else. Why not Japanese? Why not German? Why not any other language, my dude? I don't know. I feel like Spanish is a little bit more practical, but Japanese is more, how do you say it? More fun, haha, hobby, you know? Ruska still owes me art of her yin in a sexy nurse outfit. She does? Oh my goodness. Did someone mention Espanol? Sí. Dude. No, I'm gonna stop. Alright. A patient with severe crushing pain upon exertion unrelieved by rest or nitroglycerin is experiencing mild cardiac infarction. So they're going ahead and they're, what do you call it? They're having a heart attack. It's not angina because even though that is the sharp chest pain that they're having, that could be relieved with rest or medication. Well, mild cardiac infarction, you're kind of already in the, what do you call it? Kind of already in there. Ta-da! Alright, bleeding in the GI tract can be manifested as B because we learned this one. Ta-da! She drew one when she was a dragon, and now I want to see her as a yin as well. Just politely refresh her memory and be like, oh yeah. So yeah, this one's B, by the way. Hi, Watch. Hi. Welcome, welcome, welcome. Bearcat, yeah, welcome. Badang. One day I'll have arms to hug. Today's not the day. You do tease her with it? If I have time, I'll draw her. I'll fill your request. What is the significance of curse signs? So that's gonna be again gas, air, or blood in the abdominal cavity. Ta-dang. Oh, I didn't even check. I was just so excited. A. What areas of the body can GI disorders refer to? So GI disorders, again, can be pretty varied and resort to anywhere. So we have the sternum, the shoulder, the scapula. Can also refer to the anterior neck, mid-back, lower back, hip, pelvis, sacrum. So, all the above. Ta-da! Which of the following are clues to possible involvement of the GI system? Oh, this is the one we're mentioning with shingles and whatnot. So this would be B. Abdominal pain at the same level as the back pain occurring simultaneously or alternating. GI does mean gastrointestinal, yeah. Currently, these arms are for studying, not hugging. Honestly? I'm sorry. I'm typing away at my life, clicking at anything I could do to try to like squeeze in all this knowledge. Bearcat hugs look like they cure cancer? Ask Dingus. Dingus randomly came to Bearcat Mountain. It was just conveniently there. I was like, oh. And he always mentions the hugs. I'm like, oh, did I do that? I think it's very cute. It's a very cute moment. Very happy. Anyway, which of the following are clues to possible involvement? And yeah, that's gonna be B. Alright, go. You suspect your patient has appendicitis. You should. Well, appendicitis is pretty urgent, my dude. We did talk about how many things it could be mistaken for. So what we would end up doing is that the patient should seek medical attention and lie the patient down. Ta-da! What pulse width indicates a possible aortic aneurysm? So this is going to be anything over 3 centimeters, and because D is our only option, it's going to be 4 centimeters. Remember that picture I showed you, Cups? It was huge! So, hold on. Abdominal aorta. Look at this! Hold on, I'm moving it. Look at it! That is more than 3 centimeters! Hi, Dred, welcome back. I hope I get to teach you guys in Spanish one day. I can't even manage to turn on my mic on VC. Wait, are you saying that like from a boomer perspective? But are you saying that from like an anxiety perspective? So asking for a friend. Alright, D. I will be very more than happy. You could just tell me words and I'll just repeat them. I trust you, Weeb. You wouldn't tell me things. How's that relevant right now? Oh no! So Rip, TLDR. I guess medical stuff, doctors, from doctors you think of down the line and then be like, oh yeah, cool, nurses. Oh cool, a nurse outfit would be really cool. Oh, you know, Rip drew a nurse outfit for herself as a dragon. You use this tips on her. Brother, the doctor's outfits are not cute. I'm gonna have like a little Dr. Mario shiny headpiece that I don't know the name of. And like a lab coat. Boo! Give me a cute nurse outfit. Oh my goodness. Wait, now that's a combo. Hold on, we gotta look that up real quick. Wow, Robo. I understand. Oh, there's actually like, oh, actually this is kind of cute. Hold on, no, it's not saving me as a PNG. Hold on. Hold on. Eh? Oh, I got so spooked. I forgot. I was like, well, maybe not this one. This one's not as cute, but I'll show you inspiration. How about that? Something major happens, I guess. Listen, it's not a bad thing. What's this image? Oh yeah, we're talking about Higurashi. We're like, that's her outfit? Wow. Anyway. Let me pull up the other image. Whoa, this is the this was a combination of maid and nurse. I'm like, oh, that's very cute. I think like the little apron is cute. You're gonna politely head out. Have a good one, Weave. I appreciate ya. Thank you. Have a good one. We'll talk later. I'll like peer pressure you or something. That works, right? Look how cute this is too. This is I don't like top aprons, so I'm kind of biased. I'm a hater against top aprons. Not for any particular reason. I just don't think they're flattering, you know? Anyway, so I'm gonna go on this whole like, oh wow, keeps looking at stuff. No, but you know, actually, you know, to be honest, but then there's also this one. Okay, sorry, hold on. Last one. I can't get too distracted. Like, look at this one. Look at this tiny one. Ignore the quality of it. Look how cute it is. Oh my goodness. Yeah, top aprons are only cute for reasons that you shouldn't be talking about. But other than that, I could not care for them on like if they have like an actual dress underneath. Yeah, this is cute. This is the combination. This is my outfit. I'm stealing the look. Kind of. Anyway. Muscle soreness! Muscle pain! Muscle weakness! Unexplained fever and nausea are typically side effects of what? And I think this is gonna be statin. So, yes. Ta-da! 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 Increased fatigue, bilateral pitting edema, and right upper quadrant pain are symptoms of what? Bilateral? Okay. C. Right-sided heart failure. Ta-da! Because we know from the right upper quadrant pain, because we know that's associated. We know about the bilateral pitting edema, and fatigue just seems to be like a thing when your heart fails, you know? It's not working the way it's supposed to. The last one looks like similar to the old art Rip drew when as a dragon, I think? Rip, was that your inspiration? Alright. Which of the following is within range of stage 1 hypertension? I believe that's gonna be A. Ta-da! What's stage 2? Alright, we'll slowly go up. B! Yay! A Pancoast tumor will present pain pattern that... Okay, so recall very early in the stream that the Pancoast tumor, also known as the apical tumor, is the tumor that was on the top of the heart, the apex of the heart. Ta-da! So remember, this is going to have a pattern that's going to go across the chest, down the arms, to the elbows. Tipa's killing it? Wait, healing it? She's doing good. Thank you. I appreciate it. Thank you. Oh my goodness. So this is going to be probably A. Extends bilaterally down the medial upper extremities and across the chest. But remember the picture with the guy in the red. So A. Ta-da! Persistent coffee lasting 3 months with productive with production of excessive sputum that is typically worse in the morning and evening is characteristic of what? So this is definitely going to be chronic bronchitis. Remember, bronchitis is the inflammation of the bronchial tubes. This is the tubes that allow air to go into the lungs. It's chronic because it's definitely lasting more than 4 weeks. If it's more than 4 weeks, it's going to be chronic, and we know that it is a good sign to distinguish that it has the sputum, or like the phlegm, the mucusy kind of thing in it. So yeah, your patient has prolonged expirations and uses accessory muscles for respiration. And he also leans forward with his arms braced to his knees while pursing his lips to breathe. This is most likely a characteristic of... It's either B or C. I don't remember. Because we could talk about the blue bloaters. I know they have difficulty breathing. Prolonged expirations. Okay. Well, that's something to note. A major component of asthma is allergies. Hyperreactivity to allergens causing airways constriction and inflammation. Yay, allergies! No, actually, hecking boo allergies. Which of the following conditions is most likely to lead to pneumonia? Okay, this one, pneumonia. I don't remember. Pneumonia. It's the sitting and laying around. I feel like emphysema is its own thing. So, chronic? Let's go! If you have it for so long, I guess I'll just turn into something else. Is most likely to lead. Okay. Hacking, productive cough, shoulder pain, sharp chest pain, and fever and confusion in older adults is indicative of what? Hacking, productive cough, pneumonia. Yay! The confusion in older adults, remember that's pneumonia targets very young or very old people, and doesn't help with people with Alzheimer's or dementia, and it just adds on to the confusion for goodness knows whatever reason, you know? Alright, healthcare workers working in hospitals with poor ventilation, homeless shelters, or extended care facilities are at risk at what? Oh my goodness, tuberculosis. So C. Ta-da! This is why we get our shots. Alright, which of the following can lead to cor pulmonale? And I believe this one actually had said everything before. Yay! So emphysema, our status, our pulmonary embolism, and then yeah. Alright, we have like 8 more questions and we'll politely wrap it up from there, okay? A patient with tachycardia, hemoptysis, diffuse chest discomfort, and apprehension is most likely having a... Maybe it's involution? Because it doesn't sound... It's not like chest pain. And I feel like B and C are basically the same, so A? Ta-da! Neurological symptoms such as muscle weakness or muscle atrophy may be the first indication of what? Neurological symptoms of muscle weakness. I think this is C. I'm like, nothing else would add up to that. Neurological? That's so strange, you know? Hi DJ, hi, welcome. Alright, shortness of breath associated with emphysema is the result of what? So this should be emphysema, can't breathe. So definitely A, destruction of that. Reduced elasticity of the lung, yes, for sure. And C, increased effort to exhale trapped air. We did see that earlier, okay? Posture check? Oh, I got you, thank you. Hold on. Oh, thank you for the posture check. Get out of my head, Elon. Oh no, they heard you. They're recording you, and now they're like, nurse self, it's. I'm sorry. Alright, retroperineal bleeding can most commonly refer pain to where? Let's say the right shoulder. Okay, cool. We're just gonna buzz through these because it's almost 6 o'clock, so I'm like, oh my gosh. Pancreatitis resulting in fluid in the pleural space most commonly presents pain in the left shoulder. Let's go. Okay, then what's right? Bleeding. Oh, the spleen bleeding. Right. Okay. Pancreatitis is left. Okay. Upon performing psoas palpation test, you palpate a hard mass with sharply defined margins medial to the femoral artery. You conclude which of the following? Sir? Hold on. Worst typo? Why is it a typo? Baz. Hold on. Give me. I'll just be you. Hold on. Let me do that. Hold on. Alright, gamers. Okay. Let us finish the last 3 questions in peace. Yes, that's right. In peace. Peace queen. Alright. Upon performing the psoas palpation test, you palpate a hard mass with sharply defined margins medial to the femoral artery. You conclude which of the following. So, this goes back to the abdominal aorta. So the abdominal aorta eventually will split into the iliac and then I believe femoral. And if you're feeling some kind of bump on the femoral artery, I think it's very safe to say femoral hernia. Da-dang. Alright, a positive obturator test is indicative of what? Oh god, A or B? I want to say A. Remember that appendicitis is pretty serious. Maybe a good way to test it. But B, maybe you don't even really need B. You could definitely, you don't have to test it. You could just see ascites, which again is that swelling and that big belly, basically. Excuse me. Could even be D. But it's A! Yay! Okay. Portal backup and loss of proteins that presents as a distended abdomen is called. We just said it! V! Ascites! Ta-da! And our last one, referred pain patterns associated with hepatic and biliary pathological conditions produce musculoskeletal symptoms in the... And we just saw this one also, so I feel like I'm cheating. But thanks, classmate study guide. It's gonna be C, mid-back or upper back, scapular and right shoulder areas. Ta-da! And with that, we got through all 40 cards! Alright. I think from there, I should call it, because it's an hour before. I have a few DMs from my classmates who are asking me questions. I'm just like, nice. And I have a whole tab of nurse outfits up, so I don't know how my study stream went. But I would like to thank Erica for joining me today. I will keep you completely updated with the testing results. My teacher, again, is one of those people who won't put the scores up until the day after. So yeah, so hopefully by Friday I'll come with results for both today's exam and tomorrow's exam. So yay, please do look forward to it. Okay, so good luck. Thank you Starbucker, I appreciate you. Thank you. I'm super stoked to get this over with. Well, that's just me. Teehee. Alright, I'm gonna try to see about people we can raid. Oh, I almost was gonna raid the same person we raided literally yesterday. She was so nice, by the way. Not to put this out there, but I'm like, oh, she followed me back and it was very cute and I'm very happy. But I do want to raid someone different. So I have some tabs open. And oh, this game looks actually really neat. I'm trying to remember, did we raid it to this person? Yes, I do, because I see Trick there. I recognize them. Oh no. Alright. I don't know. You can do it? Thank you, I appreciate it. Thank you. We could try to go raid someone like completely new again too. Except the recommended channels that they're giving me are people I already follow, like Ara and Ty and Mango VTuber and the lady I just followed yesterday. Someone playing Monster Hunter, so I want to do it for Rip's honor, but I don't know. It looks like they made the ending, so I go EP anyway. Oh no, that's fine. Enjoy the EP. I appreciate it. Thank you for streaming. Thank you for being here. I appreciate it as well. Rip, when you go to bed, please have a good night and the sweetest of dreams. Big heart emojis. Da-dang. Da-dang. Alright, I'm going to recommend the channels today. That's where we are right now. Alright, so we can raid this person. We can raid... Oh, this person's also really cute. Let's see. And more art. Okay, Cubs, we're putting a little baby pool so I could go ahead and chill, okay? Raid! Okay, so we have art, but they're doing pixel art. There's someone playing... Oh my goodness, I'm losing it. There's someone who's doing art, but it's art. There's someone playing Elden Ring. And any other cool people? Let's see. I can't see what this person's playing. Huh. You know what? Why not? We'll put that as an option. Sure. Alright, so I'll put that poll for about 3 minutes. So we have 4 different raid targets, completely new, haven't followed them. Yes. Anyway, so we have art, or someone doing a pixel com. Second person is doing commission. They're both very cute artists. Someone's playing Elden Ring, and there's another person playing a Cruelty Squad. I'm not really familiar with what that game is. This is gonna sound very insulting. It looks like Doom. I don't know, like the same like perspective, I suppose. But their whole layout is so cool. I'm like, oh. But you know what? I might as well put them on the list so I could politely show. So thank you Evercup for joining me for today's stream. I appreciate it very, very, very much. Feel free to join the Discord. I know tonight we're doing anime night at our usual time at 8:30 unless the exam takes way longer. So apologies if that is the case. In addition, we have the Twitter. So on Twitter, I have my schedule pin. I won't be streaming until Friday at 11, I believe, to cram for an exam again. What? I know. But hopefully by sometime next week or the week after, I can free up just a little bit. And yeah, hopefully life will be good and we can actually go back to gaming now, okay? It's a very visual intensive doomer shooter. Boomer shooter. No, it's okay, Ropa. Don't worry, don't worry. I appreciate it. It did look like Doom, so I would have took Doomer as well, you know? And our last ones for socials, if you want to feel free to check out the how do you call it, other social media such as TikTok and the YouTubes and blah 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 blah. I'd appreciate it. But yeah, I think today for anime night, I think we should start off with the new series and see if they're good, and go from there? Question mark? Yeah. And then I think it would be good for Wednesday to save the Gundam. I think that would be a pretty good decision. Atomic also recommended Wednesday, so I'm all down. Da-dang. Yeah. With that as well, let us copy and paste the raid message. If you're not subscribed, absolutely no hecking worries. Feel free to use the very multi with the Gaga raid. And if you are subscribed, feel free to use the Tipanya with the Gaga raid. Okay? Okay! Polls almost ready. It looks like we have 3 votes for the person doing the comm work, so I'm very excited about that. Let me just do this, do that, do this, and we should be good to go. But yeah, Rika, thank you again for joining me for today's stream. I'm gonna cram after this raid. I'm gonna raid into the person and be like, wow, thank you for a warm welcome. Okay, gotta go. Hopefully I'll catch you Cubs for anime night either today or tomorrow. And if not, hopefully I'll catch you Friday. But if I don't catch you anytime this week, please have a good rest of your week and have an even better weekend, okay? Thank you so much and have a good one. Lots of love to you, okay? Bye! Bye-bye! Bye-bye-bye! Yeah, thank you for sharing up. Have a good one. You too. Bye, bye-bye! Bye-bye-bye! Bye-bye-bye! Bye. Bye, Baz! Bye, Baz! Bye, Zucchini! Hi! Bye, bye, bye! Bye, Starbucker! Bye! Sorry, now I have to type the name. Bye!